This is the recording of the Balance Scorecard webinar organized by the Center of Research for Non-Communicable Diseases, Faculty of Medicine and Health Sciences, that took place on the 18th of April 2021.
All right, good morning, ladies and gentlemen. How are you today on this lovely Sunday morning? I trust all of you are very excited for our webinar today. First of all, let me introduce myself. My name is Aarti, and I'm from the Physiotherapy Department in University Tunku Abdul Rahman, UTAR, and I'm your chairperson for today. On behalf of the Physiotherapy Department and CRNCD of UTAR, I'd like to give all of you a big welcome. Wow, how time has flown by. We are nearly at the mid-April of 2021. It is the Puasa season now, and I hope all our Muslim friends are having a blessed and auspicious Ramadan. I'm sure during this pandemic, this fasting period has been very challenging for our Muslim friends, and hopefully by Raya, the situation will be under control, so all of us can enjoy the Raya festivities, although in a new norm. So for now, the physiotherapy department is all geared up to bring a continuing education series on balance. The second in our series, the Balance Scorecard, aims to enlighten public about balance, improving and maintaining stability as one grows older, and prevention of loss of balance and falls. As falls and instability are a major problem, especially with senior citizens, we have gathered experts from various fields to share with us their expertise on balance and ways we can improve our balance in order to prevent frequent falls. Okay, so I'll go through the itinerary for today. Our session is supposed to start at 9 a.m. So we have introduction, and at 9:10 a.m. is our first talk by Prof. Tan Maupin. She's our first speaker for today, and her topic is falling is not a part of aging. It's a very interesting topic. That session will be for 20 minutes, and we will have a question and answer session after that, where you can pose all your questions to her and she will help to clarify them. And then at 9:40 a.m. is our second talk by Ms. Chan Zu En. And her talk is titled Ready, Steady, Go, Maintaining Balance and Preventing Loss of Balance. Sounds very interesting as well. Then she will also have a question and answer session for 10 minutes, followed by our third speaker, who is Dr. Lim Yuan Shuang. And her topic is Start with the Right Footing with the Right Shoes. Wow. And also a question and answer session after that. And lastly, there will be a talk with our yoga instructor, Find Your Stability with Yoga, which will be for 20 minutes, followed by a question and answer session. So please don't forget, if you have your yoga mats with you, get it ready, yeah? And so without further ado, let me introduce you to our first speaker for today. Okay, so our first speaker for today is Prof. Tan Maupin. So Prof. Tan is a faculty member of the Division of Geriatric Medicine, University Malaya. She completed her MBBS in University of Nottingham and Doctor of Medicine from Newcastle University, both in the UK. She has achieved numerous grants and has published more than 200 scientific articles. Her rich and vast real-life experience is of immense value and is a great opportunity for us to learn from. With this, I present to you Prof. Tan Maupin.
That sounds like a really formal introduction. Hi, everyone. It's nice to see you on a Sunday morning. Yeah, I'm here. Here I am, fresh from my morning run. Yeah, so very hard to wake up nowadays. There's so much going on. The news keeps us awake, and we wake up looking at the news to see what's going on in the world. So it's really good that everybody's taken the mind off to actually mind of the current pandemic to actually focus on other things that are also very important. And I'm really honored to be asked to talk about my experience with falls in Malaysia. And people who know me will realize that I'm a little bit crazy about falls. And I currently have a weekly falls and syncope clinic at the University of Malaya. They've been very good to me. They gave me my own space, and we have a special machinery to look at blood pressure fluctuations when people get up, which is one of the major risk factors for falls. So what I'm going to do today, therefore, is, oops.
Sorry,
Yeah, can you
Ropan?
see me?
Yeah, okay, yeah, we can see.
So yeah, so what I'm going to do today is actually to talk to you about what falls is like for Malaysia based on our research evidence and what can be done about falls. Because really, falls is something that children do. It's not something that older people should do. Yeah, falls are very much part of growing up, but they're definitely not part of growing older. So if it becomes part, if it appears in an older person's lives, we don't just leave it. We need to do something about it. And I'm sure UTAR is very much into this philosophy, which is why we're here today. Okay. So based on the National Health and Morbidity Survey 2018, the elderly, that's actually openly accessible through the Institute of Public Health website. Basically, they found that 1 in 6 older Malaysians, so in older, they define as 60 years and over, experience at least one fall each year. Okay, some of them fall 2 or more times, and of course, falls are associated with injuries. Many older people sustain hip fractures, and some of them even sustain subdural hematoma, which is what a lot of us worry about when the older person fall. And then there's but the main thing about fall isn't necessarily the injury, which is serious, but actually the over investigation nowadays that happens after a fall. When as soon as someone turns up in ED, they definitely get a CT head scan to make sure they haven't bled. So my patients who have fallen 7 times a year will have 7 CT scans a year. The brain is fried. CT scans are actually a lot of radiation. Every 75 CT scan you do, you will cause 1 cancer. So there's a lot of over investigation. Of course, we're not only just talking about CT scans. There was a lot of unnecessary investigations linked to falls, like 24-hour Holter monitors. Sometimes people even do MRIs, EEGs, carotid Dopplers, coronary angiograms, and still we haven't actually sorted out this older person's fall. They still carry on falling. So there needs to be some rationale into why this older person, what we should do when an older person presents with a fall, okay, or rather what to do if we think they are going to fall. That is they look like they're at risk of falls. That's even better. Okay. So based on the results of the Malaysian Falls Assessment and Intervention Trial, so we call this the My Fate study. I know it's ironic because we actually it's coined out of the Malaysian Falls Assessment and Intervention Trial, but the name of it means that we can actually hopefully change their fate. Basically, in the published literature, there are over 400 risk factors for falls. But from the results of the My Fate study, what we did was we evaluated 266 individuals aged 65 years and over who actually have had 1 fall resulting in injury. So they go to emergency department after that. An emergency department refers to us for a rapid assessment. Or we screen them in the primary care department in University of Malaya Medical Center. We call it the UTAR department. And they've been found to have 2 falls in the past 12 months. So we bring these people in to our falls research clinic, and we do a series of assessments to look at what risk factors they possess. Of course, it's not possible to screen for all the risk factors, so we screen for the common risk factors. And these are 3 of the most common risk factors we found amongst our fallers. And basically, medications. 4 out of 5 individuals who actually presented to the emergency department or were picked up from the primary care clinic with 2 or more falls or 1 injurious fall were actually taking falls risk increasing drugs. Of course, we can't clearly attribute that this is the cause of the falls, but they were on these drugs. So we actually consider that as a risk factors. And we know that a lot of our older people take many, many medications. And what we fail to understand, because we're not used to looking after older people in the medical fraternity, and our older people in the community are not used to growing old, is that when you start seeing lots of different specialists and they all prescribe different drugs, these chemicals in your body can actually cause havoc. They actually have chemical reactions that can result in potentially dangerous side effects. And one of them is falls in the older adult. The unsteadiness is, of course, what everybody believes to be the only cause of falls, and that only accounted for 6 out of 10 of our falls. So out of every 10 faller that we actually assess, only 6 out of them, 6 of them would have had some balance issues that might have contributed to their falls. The other thing that we found was that 6 out of 10 also had a fluctuation in their blood pressure when we stood them up. So, so what happens is that if they stand up quickly, their blood pressure drops. And that is actually what we call in scientific term, orthostatic hypotension, or OH. But to the commoner, they often know it as low blood pressure. So the blood pressure isn't low all the time. It's only low when at the time that they stand up, and therefore they fall over. Okay. And what people need to know is that if you only have one risk factor for fall, you tend not to fall because your body can compensate for the risk factors, for that one risk factor. But once you start accumulating risk factor, older people are a bit naughty. They like to hoard things. If you go to their house, there's a lot of old newspaper around, a lot of old plastic bags around. But they do the same thing with risk factors. They hoard them. So they tend to have not just don't only just have too many medications. They might also have a balance problem, and having problems with taking too many medications that impairs your judgments, make you confused, as well as having problems in your balance, as well as and the medications also cause them to have this orthostatic hypotension or low blood pressure. So the combination of these risk factors then interact, we call it act synergistically, and amplify their falls risks. And that is really why they fall. So we tend to call falls a multifactorial disorder. It simply means that falls are due to multiple risk factors. There is no one cause. It's not like what do you call that? People say TB is caused by a bacteria. Yeah, it's not like that. Falls in older people tend to be caused by multiple problems. So this is what's unique about problems with older people, and that's what our healthcare sector is not ready for. Our healthcare sector is still looking for that single unifying diagnosis, when in actual fact, when you look after older people, you look at multiple causes, multifactorial disorders. Okay, so if an older person falls, what can we do about it? So I mentioned the MyFaith study. So we recruited people aged 65 and over with 2 falls in the last 12 months or 1 fall with injury in the last 12 months. And this is what we actually did in the study. We actually administered this therapy called individualized therapy. Individualized means designer medicine. The person gets what they need. So, there's a lot of hype about precision medicine. Well, let me tell you this, the geriatricians were ahead of our times, and we were already prescribing individualized medicines many decades ago before the cancer specialists got into it. So this is what we did. When we assessed their balance, if they had a balance problem, they would have Otago exercises. And the Otago exercises was devised by the late Professor John Campbell, who was a professor of geriatric medicine in Otago, New Zealand. And basically, these exercises are designed to improve the strength around your thighs and to actually make you more steady when you stand up. Okay, so it improves the muscles. It helps build the muscles around the thighs and your hips, so that your hip joint is far more stable. We call it lower limb girdle strengthening exercises. We didn't use a walking component because we do know that when our older people walk in our very threatening environment, our pavements are really quite dangerous. Our park pavements are full of mosses. So actually getting them to walk is potentially going to increase the risk of falls. So no walking until they've actually strengthened their limb girdles. So hopefully the couple of talks after this will cover how we actually do these limb girdle strengthening exercises. We also sent the occupational therapist to the house. So 1 in 3 of our fallers actually fell in their own homes. And so we suspect that they have dangers lurking in their houses. So in these fallers, we actually sent our occupational therapist to their homes to actually go through what we call a home hazards checklists. So what the occupational therapist will look for is the lighting. Is it bright enough? Can they see the floor? The contrast between the steps, each steps, So a lot of times, a lot of older people like these parquet floors, and then the lighting at the stairwell is not very bright, so they can't tell when one step finished and the other step starts, and that's why they fall. So very simply, our occupational therapist can actually put one of those fluorescent strips with a little bit, which has a little bit of sand in it, which feels a bit like sandpaper, to actually add friction as well as visibility of the steps. So these are very simple, low-cost interventions. Of course, some people will actually venture into putting in grab bars, and also even doing renovations, putting in ramps and stuff like that. It's very important to actually involve an occupational therapist, because otherwise we have problems with extra steep ramps that don't really, that actually increase the risk of falls, etc. So, but by and large, we're looking at very common, very low-cost interventions, like advising that you got a non-slip mat from the supermarket when you have to use when you're having your bath, or outside your bathroom when you want to wipe your feet. Take away all the loose mats in the house, those sort of things. Getting a high enough chair, if not, getting a chair raiser so that it's easy for the older person to get off the chair, and also making sure the bed is not too high and not too low. Those sort of very, very simple interventions can save lives. We also have sent them for eye tests. If they actually, we tested their vision using a Snellen chart. If their vision was less than 612, then we would actually send them to our ophthalmologists. So these are amongst the individualized therapies that we actually put in. The assessment was quite detailed, and each person would actually be with us for about 2 hours. We even screen for depression, anxiety, and send them to the psychiatrist as a modifiable risk factor for fall. Okay, so this is what we found. We were not entirely surprised, because we were looking at how long it actually took to administer all these interventions in our setting. And after 1 year, we could not demonstrate any difference in number of people in those who were randomized to the individualized therapy arm compared to those who actually had what we call convention treatment. So they were not denied treatment. They were given a bit of health education not related to falls, and then they actually continued seeing their regular doctor who referred them. When we compared these two groups, we were not able to prevent them falling after 1 year. But one of the reasons why was because it took very long for them to get their appointments because of our health system. So even physio was the fastest. They could be seen within a couple of weeks. The occupational therapist sometimes was going in 9 months after they've been referred. And then the eye doctor might be doing the cataract surgery maybe in a year later. So sometimes the study had finished already, but they haven't had their intervention. So there are a lot of problems in a health system that we needed to address. But when we looked at individual components, our exercises did improve the balance, and the muscle strength was maintained. So, and compared to those who didn't receive the exercise intervention, their balance got worse and the muscle strength got worse. So, so what we really demonstrated was that by intervening, it wasn't just preventing them from falling, because if after older person falls, It's not another fall necessarily that we're afraid of. It is also the fact that they might deteriorate and get weaker and therefore become very frail. We call it the downward spiral of deterioration. And we need to intervene at that point as early as possible to stop that deconditioning. So what they do is they stop going out, they stop socializing, and because they stop moving, their muscles will waste away. So we really need to intervene very quickly to stop that happening. And by doing the study, we managed to do that more than stopping them having another fall. And what we really was able to do is actually reduce the stress because someone was doing something positive about their falls and also make them less depressed. Because having a fall to the older person is very depressing. The family takes away all the autonomy. They won't let them out of their sight anymore. Go toilet, also got someone who wants to follow them, and they're not allowed out just in case they fall. All this is don't make sense, but is actually very, very difficult for the older person's psychology. Okay, so basically, what we found was that by intervening in these older people, we made them stronger and happier, though they don't necessarily fall any less. And we think this happened because the treatment arm moved more and the control arm stopped moving. If you don't move, you don't fall, but it doesn't mean that you're all right. It just, you will get weaker and you start developing other medical problems. Okay, so what next? What we are now doing is we're actually running a study which is going to finish recruiting at the end of this month called the Life After Falls Study. The acronym for it is the LIFE study, spelled LIAF. And basically, what we wanted to do is to answer the question whether whether the fallers stopped moving after having a fall. What factors will actually stop them moving? Is it age? Is it their family dynamics? Is it their homes? And then we look at heart rate and blood pressure change fall to see whether they are actually related to their psychological status. And we go into their homes to find out what sort of homes actually help the older person stay active after a fall. And that will hopefully inform our policies in the future. Okay, so you probably knew that our study must have been affected a lot by COVID. With every great challenge comes great opportunity. And therefore, as soon as a pandemic hit, Life invented virtual assessments. So we've now developed a virtual falls assessment that we hope to actually commercialize to actually help mitigate the effect of COVID-19 on non-COVID problems in older adults. So basically, we are able to actually measure virtually mobility, memory, blood pressure drop, psychology, and social participation. Okay, so and basically, as part of the pandemic plan, if we detected any issues with any of these assessments, we would then actually start and give them exercise videos so that they could follow on at home. We would actually send them brain exercises online that they can do. We gave them tips on how to stay connected. And we also advised them to actually seek telecounseling, gave them contact details. And if necessary, they actually had a virtual consultation with a consultant geriatrician through a platform called TeleMe. So that's the end of my talk. I do need your help. We have got a student in the Faculty of Pharmacy who is struggling to get her questionnaires filled in because we actually have she's actually devised this questionnaire that she's supposed to ask older people, and she can't access older people at the moment because our pandemic has stopped her being able to go to clinics, and very few older people are coming to clinics at the moment. So I'd like to ask for your help to actually fill in this questionnaire, and I'll post the links to the questionnaire in all 3 languages in a short while. Okay, and it's on HIV, nothing to do with falls. It's just to help that poor student out. So, but if you want more information about what we're doing, here are our falls, our Facebook pages. There's actually a Facebook page for the falls research. The falls network. It's not just research, it's also for clinical practice. It's for people to share good practice and also to basically to rant about the barriers they face. So it's not very active at the moment, but we'd like to have more people join. And we have an annual falls meeting that everybody come to try and solve the problem of falls in older Malaysians. We have the longitudinal reason of the data I presented was gleaned from, and this is our Facebook page. And we now have a spin-off company to actually commercialize some of our research finding called Act for Health. And this is our Facebook website. I'd also like to invite you to the Malaysian Congress of Geriatric Medicine. Yes, it's a virtual congress that will be held in August. For more information, please go to our website to actually find out. Okay, thank you very much for this invitation, and I'm very happy to take questions.
Thank you very much, Prof. Tan. That was very insightful, very, very interesting. Okay, so we have a few questions from our participants. Okay. So from our first participant, for a parent or a grandparent who is taking quite a lot of medication, how can we ensure that they have individualized, individualized care?
Okay, that's a very, very good question. And at the moment, we are very far from this paradigm. It is very difficult to actually deliver individualized care at the moment. Infrastructure. I'm sure you all have this huge gripe about the healthcare system. You know, this doctor goes to medical school for 5 years, and then they have husband training for 2 years, and then they have postgraduate training, but they still only have one treatment for everything. Yeah, so it's like this thing needs this treatment. Yeah, so it drives me crazy. Basically, my my dementia clinic, my doctors see someone with dementia, oh, they must have a dementia drug. It's not like that. Sometimes dementia, they don't need the drug because the family is managing fine, and you tip the balance by giving the drug because they will then develop side effects. So there are loads of things to consider, and our system does not have that kind of ability. So we are actually we have to do a multi-pronged approach. We need to make geriatric medicine more accessible, and also we need to actually upskill people who have not been trained to look after older people to actually be able to do some of this individualized treatment. And we also need to involve the third sector. Okay, so geriatricians wise, we can only grow at a certain speed, you know, because it takes a long time to grow as geriatrician, and we only anticipate that we can get 350 by the year 2030. But 350 is very, very few. So we've started now a postgraduate diploma for geriatric medicine in Sunway University. That's my affiliation, so basically for people with a degree in medicine, all we need is a degree in medicine. It's a 1-year distance learning diploma course, graduate diploma courses, and basically you can then develop a subspecialty interest or a specialist interest in geriatric medicine. You don't have to go through the whole rigmarole, 7 years minimum training that it takes after your housemanship to achieve to become a geriatrician. Not everybody has the appetite or the ability to do that. So then the other approach that we are also taking on is actually educating healthcare professionals, not just doctors, all healthcare professionals, nurses, allied health professionals, and to actually do this. And the third sector. So, some of the falls assessment that you're looking at is automated. So we actually, hopefully we'll be able to build robots to do this, or actually develop algorithms, big data, artificial intelligence to do this. But at the moment we use graduates. So we can then train these unemployed graduates, because we have loads of those, to actually do these basic assessments, and they go through the algorithm, and they can actually dole out simple lifestyle management and then that will they will pick out only the ones that we need to see. Because at the moment we see a lot of people we don't need to see, and the people who we need to see cannot get to us. Yeah, it's like, oh, I need you, but I can't get to you. So what we need to do is to expand the sector, the private sector, the care sector, to actually do some of this work. So I think UTAR has a huge role to play when it actually comes to all these things.
Okay, so speaking of that, there's another question from our participant regarding Prof. Tan, just wondering, when would you involve the physiotherapist in your fall individual therapy throughout your intervention for your falling patient? Or would you just prescribe exercise videos for each of them to learn exercise by their own at home?
Okay, if they've come to me, I would not give exercise videos as first choice. That second line treatment, if you know what I mean, because they won't go and see the physio. Yeah, so I mean, it's like, what's the point of you seeing me when the therapy I want to give you, you don't want? Yeah, so basically, if they see me, physio would be my first choice. In fact, I would prefer it if they saw a physio first on me. Yeah, so but we do not have that system at the moment. It's very doctor centric, totally non-economical. As you can see, a lot of those you don't need a doctor to do. Yeah, so and my salary is very expensive. So if I'm going to have to do each and every one of those assessments, first of all, it's going to cost a lot. Second of all, it will reduce the number of people who can actually get geriatric care. So I'm hoping that with all these assessments, then I can first of all select out those who don't need to see me, and for those who need to see me, I only need to spend the minimum amount of time so that I can see as many as possible. But that kind of economic thinking is not in our Malaysian mindset at the moment. Yeah, I mean, I get so frustrated with patients who will not see anybody but me, and I can be very mean to them. I don't mean it. It's just that, you don't need to see me. Please give other people a chance. But it is a way. There's so much public education to do right now. So I'm very appreciative of this opportunity today.
Okay. Next question from our participants: what are the preventive measures needed to take for those who are in their 50s?
Okay. Yeah, it's never too late, but it's also never too early, right? Yeah. I mean, the formula is so simple, but nobody wants to follow it. You know what I'm gonna say, right? Yeah. So stay healthy. So what you need to avoid getting to have being on too many drugs, since you need those drugs in the first place. So, healthy lifestyle. Yeah. So you need to eat very healthily. You need to exercise at least 30 minutes a day, 5 times a week. Yes. Apparently you can accumulate it. So you can binge exercise instead. You can do all 150 minutes in the weekend if you want to. Yeah. But those are things that you need to build in right from the time you are born. It's never too late, but it's never too early to start. So what we're trying to do now is to actually work with pediatricians, educate their parents when they are being brought up. They are accustomed to eating fruit and vegetables, and children love fruit and vegetables if you help them build the taste early. We tend to think children like sweets, they like biscuits. My children don't eat biscuits. If someone gives me biscuits, it goes to waste, because they've been brought up to, I know, don't say poor kids, yeah. They've been brought up to eat, fruit. They love fruit. They love mangoes. They love all sorts of very sweet fruit. And also now they've started eating vegetables, not because I force them to eat vegetables. If they never force them to eat anything they don't want to eat, we actually eat those things ourselves. And then eventually they will eat it because they know that it's good for them. Yeah. So, and then they get the positive feeling from having done something good for their body. Yeah. So those things have to be inculcated from birth, preferably, but never too late.
Okay, quite a few questions coming in. We'll just go for the dear Prof. Tan, great to hear and know about the real life experience. Maybe know, how do you monitor the exercise? Do you conduct them online or as a group therapy? How do you manage the red flags, falls and all while performing exercises?
Yeah, we haven't managed group yet. Yeah, it's very challenging to get our older persons to a physiotherapist, because the child has to take the time off. And people where got so much time to take the parents off to go to physio, yeah, unless you don't work. And the very few families can afford not having both couples not going to work anymore. So we actually, for the Otago exercises, we tailored it as an individualized exercise, as an individual home-based exercise, and our clients only needed to come once a month. So they get taught these exercises, given pictures, and then 1 month later they come, they have they get it what do you call it, escalated. They escalate the exercise. So that's so it's 4 visits in total. You have to beg and beg and beg, and then they came. But the results were so good. It was just doing that. It just shows how low they were at. But by actually getting them to do that, the results were so good. So how did we get them to do it? It was the getting them to diary. Yeah, telling them, getting them to actually fill in their diaries and to get them to do it at least 5 times a week. So working with them. But surely there must be better ways of doing this. So we would like to actually explore group exercises, but the challenges of getting a group of older people in one playtime is something that we have not overcome.
Okay, so we have quite a few questions, but due to time constraints, we are not able to answer all the questions. But if you have any pressing questions, you can kindly send us an email and we will get back to you. Thank you very much, Prof. Tan.
Thank you for inviting me.
And now we will proceed with our second speaker for today. All right, okay. So our second speaker for today is Ms. Chan Zu En. So Ms. Chan is qualified as a physiotherapist from Manchester Metropolitan University, UK in 2009, and she started her career in Tan Tock Seng Hospital, Singapore. She soon found passion working with neurological patients and soon pursued her master's in neuro rehabilitation from the University of Nottingham, UK in 2013. She specialized in managing patients with dizziness and balance disorders. As a senior physiotherapist, she was heavily involved in running workshops and training students as well as junior physiotherapists. After gaining clinical experience for 10 years overseas, she returned to Malaysia and held the position of the head of the physiotherapy department at University Tunku Abdul Rahman. Currently, she is lecturing part-time at UTAR and is practicing in PAU Physiotherapy Rehab, which is in Kuala Lumpur. With this, I present to you, Ms. Chan.
Thank you, Ms. Ati. I hope you can hear me well for the kind introduction.
Yeah, we can hear you.
Let me just start with sharing my screen. What a wonderful start of the morning on a Sunday. Thank you very much for Prof. Tan for that very insightful talk on what's happening in Malaysia and what is actually doing in terms of looking at our fallers in the country. So following after that great act, I'll be talking about how we can maintain our balance and prevent the loss of balance. So sort of a pre-faller talk that we're going to be going through. The title of my lecture, or not really a lecture, a talk, is really Ready, Steady, Go. Just to give you a brief introduction of what to expect, an outline of today's session with me. The first thing, I'll be introducing what are the different sort of areas and factors that influence as human beings. Then we'll go on to how we can maintain our balance, and this is really sort of the bulk of my talk. And it's really preventative strategies that we can do, the different areas that we can target. So what if we have actually lost our balance? What if we've fallen? What can we do about that? So that's the third part of the talk. What can I do to not lose balance again? And this sort of interlaps quite nicely with Prof. Tan's talk earlier. Of course, I'll just briefly go through some bits that she has already shared about, just to sort of link that together, and also what physiotherapists we do for fallers as well. And then we'll conclude. Okay, so let's jump right into the introduction. So having good balance here really means that we are able to control and maintain our body's position. And it's really in sort of two sort of conditions: when our body is moving, and also when our body is static in a very still position. And the flexibility of our human body is quite amazing, that we can do this in two situations. Okay, so the body is really, really complex, and we have various systems in our body interacting with each other to help us maintain good posture in different situations. So usually with my physiotherapy students, there's a lot of these medical or physiotherapy terms that I use to describe these different systems. I've tried my best to try and make it a bit more simpler so that even people who are not medically trained or not physio trained will be able to understand this. Okay, so what helps us balance? So I've kind of grouped it into four main categories. The first is the hardware, and then we have the software of the body, we have the wiring of the body, and last but not least, the sensors. Usually in physio terms, some of these subcategories, I've lumped it together. So I know that there are quite a few physiotherapy students within the participants, so familiar, but this is so that everyone can understand this better. So what does hardware actually refer to? Hardware really refers to our physical structure, okay? Muscles, tendons, ligaments, joint integrity, the strength in our bones, and all these provides physical mechanical structure. And this is really important because this is our frame. So that's a big part of how we help balance, how we maintain balance. The next is the software. So the software, I kind of think about it as the computer of our body. So it's kind of like the brain, our thinking speed, our cognitive. This also sort of ties in with our psychological state, our mood, and behavior. Okay, so that really plays a part, all right? And when we have something wrong with our software, that can also increase our risk of falling in the future. The next one is wiring. Okay, so wiring, I term this as sort of like the reaction strategies, our movement strategies, the flexibility of adapting to different situations. So this kind of like reaction speed. For physiotherapy students in the crowd, this is looking at anticipatory and reactive movement strategies. Okay. And last but not least, a very important one is sensors. Okay, now sensors here really refer to the three main systems, sensory systems in our body. So the first one is vision, as Prof. Tan mentioned earlier. You know, the ability to see, all right, is very important. As you mentioned in her study, they did eye examinations. It's important for us to be able to take in what we see so that we can react appropriately to our environment. The next one is the feelings through our skin and joints. So the medical term for this is a somatosensory input. But basically, it's how well we feel through our skin. And if that is compromised, we can't really feel the surfaces that we are stepping upon. And if we can't feel, right, we're not gonna be able to balance very well. And the last one is the inner ears. So not sure whether you know, but our inner ears, we have a balancing organ. I believe yesterday we had this webinar for physiotherapists, and we talked about the vestibular system, and that's really the system maintain sort of uprightness, all right, throughout space. And also, if there's something wrong with our vestibular system, we can have symptoms of dizziness, floating sensations. Vertigo is a common term that is also related to vestibular problems. So what happens with these four systems, right? These four systems don't really interact by itself, all right? Like I mentioned before, the human body is so complex and amazing that all these four systems actually interact with each other to provide the ability to help us control balance. And sometimes when a certain area is not doing so well, other areas can chip in to help out. You know, it's a camaraderie system in our human body. There's that flexibility. Okay, but what happens when we grow older? I'm sure you kind of gathered that, you know, as we grow older, the machinery sort of takes, you know, has taken there's wear and tear, right? Because as we grow older, things don't work as fluid and as well. So yes, all four of these systems, they sort of reduce in their ability to function as how we were when we were in our younger days. So what happens when our hardware fails? Okay, we can be susceptible to injury, weakness of the muscles. Another term would be sometimes muscle wasting, so that that muscle doesn't really work as well. We can have stiffness throughout the joints, just because our lubricant isn't, you know, working very well to help our joints move very well. And also joint disease, degenerative conditions such as arthritis. I'm sure you've heard of this. Arthritis of the knee, of the hip, and these can also just compromise our hardware. The other things would be bones, so the stability of our bones, the hardness of our bones. As we grow older, we are at higher risk of bone thinning, and another term would be osteoporosis, really. But yes, so the hard beating, right? The software, right? Our brain, our cognitive ability, as we grow older, we do have a bit of a slower thinking speed. We can't really multitask very well. There's also a fear of falling, all right? That's more of a psychological aspect. And research has shown that even having the fear of falling itself can increase the risk of falling in the future. So that psychological aspect. And as we grow older, we can have software diseases such as dementia or other neurological conditions such as stroke, cognitive impairment. Next, we move on to the wiring. So wiring, as we grow older, there's a bit slower reaction, preparation phase, and also reaction time to when we lose balance. And that slowness will compromise our ability to control balance. And last one, for our senses, as we grow older, we do get conditions that affect our eyes, such as cataracts, other conditions like glaucoma, or sometimes our far-sightedness or short-sightedness, it changes as we grow older as well. And so that's something that can also compromise the way we perceive. The feeling to our skin and joints can reduce just because some conditions, medical conditions, actually compromise this as well. The most common one would be diabetes. And for diabetes, the peripheral or the most distant part of bodies tend to lose sensation, sometimes in our fingers, but more importantly related to balance would be our feet, right? Our feet and ankles, they can't really sense very well on the surface that we're stepping on or standing on, and that can make us lose balance easier. The inner ear, so there are also a range of things that can happen in our inner ears that compromise us to perceive what is upright. One of the common vestibular conditions is something called BPPV, and that is where, because of degeneration within a specific structure in the inner ear, there are these calcium carbonate crystals that are floating within our semicircular canal, and when we move in a certain angle or do certain positions or movements, it causes that spinning sensation. And if you have have this spinning sensation, of course, it's going to be very difficult to maintain balance. Other than that, the inner ear could lose its hair cells, and when it loses its hair cells, it's unable to detect movement as well. So that's going to compromise our balance. Right. So we kind of talked about influence our balance. How well do we actually balance? There are a number of balance tests out there that are being used to detect how good our balance is, but also more importantly as well to detect fallers. Now, unfortunately, it's not really within the scope of this talk to go through all of these tests. But I just want to introduce two very common ones, very quick ones to do. The first one is standing with one foot in front of the other, and this is kind of like a tandem stance. Now, as you can see in the video, she puts her arms across her chest and seeing whether she can maintain her position, maintain upright for 30 seconds. Also, you can see that she's closing her eyes. So now, obviously, you would try and do it with your eyes open before you would go on to the next level of doing it with your eyes closed. The cutoff mark is kind of like 30 seconds or so, whether you can maintain this balance. The one on the right is a single leg standing, so a unipedal stance. So this is a bit more difficult than the one that I presented earlier. So this is really standing on one foot. Again, you would try and see whether you can stand with one leg. And then if you can do that really well, then you would move on to closing your eyes to see whether you can also maintain that posture. Now, obviously, balance tests are actually to challenge your limit. Now, it's important then when we're doing these balance tests that we ensure a safe environment around us, because the last thing that I would hope for is that when you're doing the balance test, you take a fall. So that's really not advisable. So we would always do these tests near support, so that if we do reach our limit and we tip over, there's something for us to hold on to or lean against. So I would usually do this test with my patients with a wall beside them, or there's a rail beside them, and so that they also feel a bit more assured when they're trying to challenge their balance. All right, so you can try these out later on. Just be very careful, all right? And even if you can't do it, at least you sort of know your baseline, right? So that's a couple of the balance tests. So now we move on to what can I do to maintain balance? The idea is that we're going to train the four sort of systems that I talked about earlier. We want to train the hardware, the software, the wiring, and the sensors. Earlier on, our body is really, really complex and amazing in a way that some of the trainings that I will be talking about, it doesn't only train a specific factor, it doesn't only train hardware or software. Usually we would try and, one stone hit a few birds. And so you would realize some of the trainings actually target maybe 2 or 3 of these, or even 4 of these domains. So the 4 things that I will be talking about, first one is stretching. All right, so this is really more on the hardware a bit, flexibility of our mechanical structure. And we'll talk about which areas do we want to focus on. The strengthening, because strengthening is really referring to the muscles. And then we have balance. So balance is kind of like integrating all 4 domains together. And there are different conditions that we can sort of place a bit more emphasis on, whether it's wiring or the sensors or the software. And the last one is cardio. And cardio is really also related to just keeping healthy, having a healthy lifestyle, as what Prof. Tan mentioned. If you're in your 50s and you want to know how you can sort of prevent falling, take even a step back, how to prevent, us from developing blood pressure problems or diabetes or cholesterol and whatnot. All right, so that's more related on disease prevention. Okay, so for stretching, stretching is really looking at focusing on the leg muscles. All right, we do need quite a bit of flexibility in our ankles to help us balance. All right, so the first one is really a calf stretch. And in this stretch, really, the most simplest form of doing this is really leaning against the wall. As you can see here, the hands are being supported against the wall. And in this picture, the left leg, the left calf is the one that is being stretched. As you can see, the heel is down on the floor, fully extended or fully straight, okay? And the idea is that you kind of want to lean forward as much as you can while keeping your knee straight and your heel down on the floor. Now you should feel some stretch in this lower part of your leg. Now, go to a level where it's a sort of, you feel the stretch, but it's not giving you a lot of pain. You want to hold it there for a duration, and we'll talk about that. So this is the calf stretch, and then after you finish this one, you can change your foot position and stretch the other one as well. So this gives us this flexibility of the ankle. The next one is the hamstring stretch. This hamstring stretch is really to stretch out this muscle at the back of our thighs. This is usually the sort of safer way of doing this. You're sitting on a chair, you kind of want to come forward a bit so that you can lean forward a bit more and have a better stretch. The idea is that you want to keep this knee straight, and you're going to lean forward as far as you can, and it's really coming from the hip, bending the hip forward. Again, you want to keep this knee straight, and when you feel a comfortable stretch behind, you want to sustain that duration again. So stretching is all about sustaining that position. Otherwise, if it's really short, then if it's like a few seconds, then you're not going to really get a lot of benefit from that. The last one is really this thigh muscle in front. So this was at the back, and this is in front. All right, and this is very important as well. So as you can see, because you're kind of standing on one leg, you want to have some support to balance yourselves when you want to stretch this one out. You should feel the stretch in the front of your thigh, and again, you want to hold it there. So how many repetitions should we do this for? 3 to 5 repetitions, and we're looking at holding to 10 to 30 seconds. Of course, the longer you can hold a stretch, the more benefit you're going to get out of the exercises. So we're all about, you know, getting the most value out of what we give. So hold it a bit longer if you can, tahan, all right? But if you can't, then you want to start small and work it up as you go along. So that's stretching. Now we move on to strengthening. So strengthening the leg muscles. Prof. Tan earlier talked about otago exercises, and that looks at strengthening the lower limbs. And yes, definitely we would be looking at this area, and namely in the ankles, hips, and knees. What is interesting as you look at some of the research on balance control, as we are young, you know, we do rely a lot on our ankles for our balance. But as we grow older, what is seen in research is that we don't use our ankles as much, and we rely a bit more on our hips. But what if our hips or knees aren't strong enough? That's where our balance is compromised. So we want to sort of train all these muscles around these joints so that we can still utilize our ankles to help us balance. And if, you know, our ankles don't balance right, at least our backup is quite strong in our hips and ankles. So the first exercise here is a tiptoe exercise. You can see here again, you're holding on to balance and you're lifting up your heels off the floor. And you want to sort of keep it up as high as you can, and you should feel your calf muscles at the back squeeze. So this is the first exercise, right? Working on these ankle strategies as well. The next one here is a hip abduction exercise. So what this exercise is purpose for is to strengthen this lateral, the side muscle of our hip. So when we lose balance from side to side, you know, when we sort of trip over to the side, we do need quite a bit of our hip muscles at the side to help us stop ourselves from falling. So this is a way to strengthen that. So again, you're holding on to a support. This leg, the body, you're going to try and keep it as upright as you can. And this leg, you know, try and keep it extended, and you're lifting up to the side. Okay, and you should feel this part of the muscle working really hard. Okay, the next one is working on our back portion of our hip muscles, and this is called like a bridging exercise. So you're kind of lying flat here, and the idea is that with your knees bent in this manner, you're going to lift up your hips off the surface of the floor, and you should feel this back portion of your muscles work really hard too. Okay, so that's the bridging exercise. Last but not least is sort of an overall sort of exercise. It's a sit to stand exercise where we're from a sitting position, we're going into a standing position, and we're working these quadriceps, the quadricep muscles, the front thigh muscles. It also works a bit on our hips and our ankles, but really more in our thigh muscles. And this is a very simple exercise that can be done. So how often, or sort of how many times should we do this for? We're looking at maybe 3 sets of 8 to 12 repetitions. So if you're not really familiar with these exercises, you're doing it for the first time, you may want to start off with a lower repetition count, and then you're going to work your way up. All right. You can take a break in between sets, maybe like sort of a 30-second rest in between each set. There are many ways to progress this further as you grow stronger. The idea is that it's all about giving a challenge of your muscles. So if the exercise gets a bit easier, there are ways to progress it, such as putting on some weights, so strapping on some ankle weights, holding it for longer is another way to progress it. So you may start off with only doing it, just lifting up, and then not holding, to lifting up, and you're going to hold it for 10 seconds, 20 seconds before you put it down. So first way to progress is putting on weights, strapping weights on. Second way to progress could be holding the contraction a bit longer. Yeah, so that's really how we want to strengthen our muscles. The next one is on balance training, and this is more like a multi-component. We're targeting all 4 of these: hardware, software, wiring, and sensors. There are different types on how we can train balance by giving a bit more emphasis in certain areas. Just to give you a few examples on how we can do a bit of balance training on ourselves, you can see here just being able to stand on one leg. We're training a bit more on the software, a bit more on the hardware, but also a bit more on the wiring process. So because we do need that reaction speed to catch ourselves as we tip over. To give a bit more emphasis on training our senses, so like our inner ears, our ability to balance whilst looking at the environment. You can stand on a surface that is a bit more wobbly in nature. That way we're relying on our other senses a bit more, like our vestibular system. This is another way to do it. Of course, standing with both legs are easier than standing on one leg. So you may start off with a wider base of support, and then you could work towards narrow bases from a firm surface. You could look at then progressing it to wobbly surfaces or uneven surface. This is a wobble cushion, and this is a sort of a foam cushion. But if you're at home and you don't have these things, you don't really need to buy it. It's all about being economical nowadays, right? So you can do a makeshift of it. If you have an old pillow lying around and you have no use for it, you can be standing on a pillow. Again, you want to be safe when you're doing these exercises, because balance training is all about challenging where your limit is, and you want to do it in a safe manner so that you don't develop the fear of falling, which again, increases our risk of falls. So this is more in a static position. All right, and then we have a bit more sort of in movement, a bit more exciting in a way, because it's a bit more dynamic. So this is walking with one foot in front of the other, like a tandem walk, like a tightrope walking. This is really challenging our reaction, sort of our wiring a bit more, being able to sort of have that flexibility when we're moving through space. This one is sort of a stepping forward kind of exercise. Again, to be able to balance yourself in this position requires all these these systems to work well together. Over here, you can see that we're training a bit more on that software. So standing on one leg and being able to do a secondary task. So dual task training is also a way to improve our software to help us balance a bit better. Because as I mentioned before, as we grow older, it's harder to multitask. But honestly speaking, in real life, it's not easy to only focus on one task at a time. And so we do need that flexibility to be able to dual task or multitask in certain situations. And how do we do this? How do we train this ability? We do it in a graded manner. So start off, balancing a pretty stable surface, and then you may want to add a secondary task that is kind of, not too challenging. And then as you get better, you can work on a harder task. So one way would be, maybe instead of just catching and throwing a ball with a person, you may just want to catch and throw the ball with yourself first. Make sure that you can kind of get that down before you add in a bit more higher level difficulty. So this is more of a movement secondary task, but you can have cognitive brain exercises as well. So starting off, maybe counting backwards, all right? And then if you can count backwards and balance on one leg, maybe you want to count backwards in 3s and balance on one leg. You get that down, maybe you want to count backwards in 7 and balance on one leg. So that's how we can sort of train the versatility of our body. Right, so yes, balancing while doing challenging movements and balancing while multitasking. Other sort of examples could be more of like an obstacle course. Some gardens or park areas have these unstable sort of terrain for people to practice their balance. Of course, you will want to be careful when you're doing this while you're sort of balancing on these different surfaces as well. Right, then we're moving on to cardio. So cardio, as what Prof Tan had mentioned, it's about squeezing in 150 minutes of moderate intensity aerobic per week. So 1 week, 150 minutes. What does moderate intensity mean? So if I give you a scale of 0 to 10, 0 meaning you're sleeping, you're not doing any activity whatsoever, and 10 being you're running from a lion, right? You're doing a lot, exerting a lot of energy at that point of time. You want to kind of aim in the middle, sort of a 5, 6 out of 10, and that would be sort of moderate intensity. So another way to gauge this would be, are you able to speak fluently when you're exercising? No, you shouldn't be able to speak fluently. It's kind of like you're able to say a few words, but you're out of breath. And that's kind of how you gauge. So if it's too easy, strolling in the park, I can, conduct full conversations and speak in full sentences. I'm not huffing and puffing. I don't think you're working at moderate intensity, probably at low intensity. So you kind of want to work in a bit of breathlessness. So there are many types of walking, jogging, cycling, and swimming. And these may not directly affect the ability to control balance, but it definitely helps with disease prevention and also just managing conditions that you already have. So it's good for heart health, lung health, controlling our blood pressure a bit better, managing our cholesterol and blood sugar levels, and overall brain health, because as we exercise, we're getting more oxygen to our brain, our cells in our brain are getting its nutrients. So disease prevention, in the long run, it reduces our risk for falls. So what happens? We've moved on to our third part. I've fallen. What can I do to not lose balance again? And this kind of ties in with what Prof. Tan mentioned about an individualized approach. All right, there's a lot of investigative work that try and do to see what happened, what made you lose balance in the first place. All right, did your legs trip? Did your legs give way? Or was it painful? Was it pain that caused your legs to give way? Do you feel like there's numbness in your feet? Is it because of dizziness or fainting? Or did someone bump into you and you didn't really know how to catch yourself? Or is it a slippery floor? You know, the environment was unsafe. So these are some of the questions that you can ask yourself to sort of do a bit of that investigative work on your own. But otherwise, you know, if you've fallen, it's always good to see a healthcare professional, see a physiotherapist, what Prof. mentioned about, you know, to do a fall assessment. And she mentioned about, you know, looking at certain areas specifically. And if you see a physiotherapist, we would be asking a ton of questions on history of falling. How did you fall? Were you able to get up? Did you have any symptoms before you fell? Which direction did you fall into? So it really helps us to guide where sort of the problem is. We do a physical examination for you as well, looking at are your muscles tight? Is your hardware doing well? Maybe it's not doing well. Maybe there are certain areas in your muscles that are not really working very well. It's sort of weakened, or is it because of a cognitive impairment or wiring or sensor problem? So that really helps us to be able to come up with a targeted treatment plan for you. Right? So what went wrong? Is it any of these systems? The good thing about our human body is that if something has gone wrong, and unfortunately maybe we can't do much about it because of the illness or whatever, the other parts of our body, the other parts of our system can help compensate a bit. Like I mentioned more, it's a teamwork, right? So the other things that you can do about it, well, I focus a lot on physical activity, but looking at our diet, making sure, you know, our body, our hardware is getting enough nutrients. We're not, you know, having sarcopenia or osteoporosis, you know, making sure our bone health and muscle health is good. Assistive devices may be something that we may need to prescribe. Different assistive devices are applicable to different patients. So it's important to understand which device is suitable for you. And that really involves a physiotherapist to come in and assess that for you. Other than mobility aids, it could be visual aids, making sure that you're seeing very well, referring you to an optometrist or an ophthalmo doctor as well to check your eyes, or hearing aids to make sure that you can perceive your environment better. The last part is also medication review. If you're taking a lot of medications to manage that, and living environment. So as mentioned by Prof. Tan about, you know, having an OT to look at your environment in your home, prescribing necessary things or doing certain strategies to line places, or install grab bars or ramps and whatnot. Okay, so it's really dependent on the individual, and that's why an assessment is really important. So I just wanted to put out a disclaimer as well, that some of the exercises I've shown here may not be entirely suitable for your level or for your condition. So it's important that you do maybe see a physiotherapist to have a, sort of a balance assessment. If once we do a balance assessment, we know what level you are, and we can prescribe balance exercises that is applicable for you in a safe way. The last thing I want to hear is, you know, follow Miss Joanne's exercises and then I've fallen. That's really not what I would hope for. The balance exercises are meant to challenge, so, but you know, you want to do it in a safe manner. My second point is, if the balance exercise is too easy for you, you're not going to really get anything out of it. It's like I would talk about, you know, a university student doing standard 1 homework, right? It's too easy. It's not going to help the university student improve. So you want to target at the right level. Yeah, and always be safe and perform next to steady and firm support in case you lose balance. All right, so in conclusion, I think I've overrun my time. In conclusion, keep your body active, all right, physical activity, looking at the different sort of types of exercises that we shared, keep your mind sharp, keep your medical conditions under control, and this includes your medication as well. Also, just to be a bit more vigilant about the environment around you, to make sure that it's, you know, there are no hazards in the way. And so that really concludes my sharing, and I'm free to take any questions.
Thank you very much, Ms. Chan Zuen. Okay, we have a question from a participant. What is the difference between proprioceptive training and balance training? Can you give examples on proprioceptive training?
That's a really wonderful question. I would say that it's important to sort of define balance training. Like I mentioned, balance training is multi-component, and honestly speaking, proprioceptive training would fall under balance training because balance training is about, different things that we're incorporating. So in terms of proprioceptive training, it's all about being able to sense, having the keenness on the surfaces that we are stepping on. So proprioceptive training really is to encourage the person to be more aware of the surface that they're standing. So what I would do would be usually to narrow the base of support. Once we narrow the base of support, the patient or the person will have to be very concentrated on what's going on in their feet. Where is their center? Where's their center of gravity leaning towards? And as we train that, they become more aware of their proprioception. So sort of different sort of surfaces. It could be, usually I would go for narrow bases first, and then sort of work from there, maybe giving a bit more wobbly surfaces as well.
All right. Thank you very much, Ms. Chan. And then to all our participants, if you have more questions, our speaker will be with us till the end of our webinar. So you can still post in any questions, and I'm sure she'll be happy to answer you. Right now, we'll move on to our third speaker for today.
Hi, everyone.
Hold on, please. Yeah, okay. Thank you, Dr. Shuang. So let me introduce to you our third speaker for today, foot and ankle specialist, Dr. Lim Yuan Shuang, graduated from the University of Western Australia with a Bachelor of Podiatric Medicine in 2013. She currently has more than 10 years of experience in clinical podiatry and has been selected as a visiting lecturer in International Medical University, IMU, since 2018. Her career spans working in Sunway Medical Center, after which she opened her very own private clinic. Her enthusiasm towards providing the best foot care has also gained a few interviews from the media, such as articles on Health Today magazine and Star newspaper, as well as live interviews on BFM and TV3. Clinical biomechanics of lower limbs and the correction of feet when walking, which includes pediatric podiatry conditions such as flat feet and in-toe walking, are particularly of interest to her. With this, I present to you Dr. Shuang.
Hi, good morning, everyone. So today we will be talking about, let me show my slides. Hang on. Okay. Okay, so today we'll be talking about start with the right footing, so mainly about shoes. So the first introduction to myself. Sorry, I don't know why. Okay, so many people are not familiar with podiatrists in Malaysia as of now, so I will just go through briefly what we do in our normal clinic days. So we are foot and ankle specialists focusing on conservative treatment. So the difference between us and orthopedics are that we do more of trying to prevent them from going through the invasive treatments like surgeries and even like steroid injections. So we try to help you before you enter that stage. Like if you have tried all the conservative method and it didn't work, then it's most likely that you need a more invasive care. So biomechanics cases are such as flat feet, in-toeing, flat feet for all ages. In-toeing are more treatable among kids, but as you age, hit a certain age, around about 10 years old, then you are not really reversible. And then more common things that we see are like plantar fasciitis, metatarsalgia. Metatarsalgia is the pain at the bottom of the foot, okay? And then, the balls of the foot. And then Achilles tendinitis will be more of pain behind the heels. So these are the problems that can affect people from any ages, any age group, from kids to adults to elderly people. You know, it can be caused by shoe wear, wrong footwear. It can be caused by the extra activities that you exert on certain parts of your muscles. Or you are born with very bad biomechanics, and so you're prone to these kind of problems. And then nail and skin disorders are the more common ones that we see, and we see in again any age group. So corns, warts, the difference between corn and warts. So corn is more commonly seen in elderly because as we age, the fats under our feet it loses, so we become a fat atrophy, okay, among the foot pad. So fat atrophy reduces the padding on the foot, and therefore when you walk, it drops more. The increase of the friction causes callus and corn to be produced more easily. So that's why corns gets very painful and needs to be removed. But you don't really need to go through surgery for corn removals because it will keep coming back. It's like a guarantee that it will come back. So you just need to, you know, constantly remove it. And if you're diabetic, then we don't advise removing corn on your own. Like a lot of people use the shaving kind of pumice stone to remove their corns, their calluses. You can do that and it's painful, but if you're diabetic, then you are prone to vascular diseases and also neuropathy where you don't feel your feet. Then in that case, we don't advise removing on your own. Okay, warts are more commonly seen on younger people, like kids and normal adults, because we are exposed to, we step everywhere, we go everywhere, and usually it's a wet environment that warts grow. So if you go to gym a lot, or if you certain work that requires you to take off your shoes and step into the house in many different areas, you get exposed to the HPV virus more easily. But this strain is different from the one that the uterus, the women HPV virus strain. Okay, it's a different strain, so you can get it on male as well. And then ingrown nail, as we get ingrown nail, again, it happens on all age groups. Some people are born with very curved nails, so we call it involuted nails, or very broad nails. So these are all problems that can start ingrown nail. And then hyperkeratosis is a condition where, again, we see on more elderly people, they get very extremely thick skin that sometimes even be flaking. So that can be, sometimes looks like a fungal skin. So that we need to differentiate if it's a hyperkeratosis where it's just hard skin, just application of cream with urea, or fungal medication. Okay, and then onychogryphosis is a condition that we again see more common in the elderly people. Onychogryphosis means extremely thick nails that's happening on elderly. So as we age, it's actually just like our hair turning white. Okay, the nail quality gets bad, and then when it gets bad, it gets a bit haywire. So it gets very, very thick. Okay. When it gets too thick, there's not enough nutrients to supply the nail, and therefore the nails get discolored. And that's why a lot of people will always think that, oh, I have fungal nail, but actually fungal nail is actually not that common among elderly, because it's more of onychogryphosis, it's just thick nails. Okay, so we will have machines that thin the nail down. It's not painful. It's just something to make the patient feel more comfortable when they wear closed shoes. So closed shoes are more important shoes, especially when you want to prevent falls. So we'll talk about shoes again later. And then diabetic foot, again, is more common among elderly as well. If you're diabetic, it depends on how bad your diabetes is. Usually, if it's very out of control, then the endocrinologist will refer these patients to us. So to give a diabetic foot education. Okay, so how to prevent diabetic foot and at what stage you are at the high risk foot category. Okay, so diabetic foot ulcer, if you already have an ulcer from diabetic foot, then we are the first lines to treat your ulcer before it reaches the stage where you have to go for amputation. So we shave the ulcer, we do treatment, we do dressings, we decide what kind of dressings to be used on the patients. Okay, so next, okay, so back on focusing on shoe wear. So these are the few main factors that affects what kind of shoes that you should be choosing. Okay, medical health condition, again, more commonly is diabetic foot that affects the feet. So that's right, a lot of my focus here is on diabetes. So if you're elderly and you're diabetic, and if you have neuropathy as well, then you should be looking at something that's more closed shoes to protect your feet. We'll go into detail again later. Peripheral vascular diseases means usually arterial or venous. So arterial means blood that supplies to your feet. If you don't have enough blood that supplies to your feet, it can tend to turn black. So that's gangrenous toe or foot. Then that's something more severe. No matter what shoes you wear, unfortunately, it doesn't really help. But venous condition is where too much blood focusing on the that's flowed and stuck at the feet and it's not going back to the heart fast enough. Then venous condition patients, you just need to protect your foot well, then so that you don't get any cuts. So if there's any cuts, because you can imagine there's so much blood and so much fluid over there, so it's not going to heal well enough. Okay, and muscular strength is that, so if you're still a very strong elderly person, then it doesn't really matter which kind of shoes that you go for, because you can recognize pain, you know what's not good for you. But if you are, the elderly type, they're very weak, then of course we recommend them to go for something light. Types of feet, again, flat feet, high arch are the most common ones. Most people are neutral actually, but flat feet are more commonly talked about because of the other problems that they bring around. Okay, presence of corns and calluses, like I mentioned just now, the hard skin growth. So we see that a lot among elderly because of the fat atrophy. So we have to try and pad it so that it doesn't grow so quickly. It will still grow, but it doesn't grow so quickly. Okay, so first, we talk about diabetic foot. So this is the diabetic foot ulcer. I know, sorry, a bit gross for Sunday morning. Diabetic foot that we talk about here, the ulcer, there for neuropathic ulcers, the most biggest sign that we see is thick callus. Okay, so if it's surrounded by thick callus, then it's most likely due to neuropathy, diabetic ulcers, that it's due to pressure. So the patient, so for example, like the corn that we talk about, if a diabetic patient, they have neuropathic, then they are neuropathic, they cannot feel the feet, then the corns and calluses are the main points that will turn into ulcer, because they cannot feel pain and the corn continue to press into your foot. Then eventually it damages the skin inside and you still don't feel anything, and then it breaks down and becomes, first of course it usually becomes like a hematoma, like a bleeding inside, and then it just, a little bit of wet fluid flowing. Then if they are very old and they don't really take care of their feet, no one's looking at their feet all the time, then they don't know what's going on, then it gets wet, and then next thing, when you find that it's smelly, then usually it's infected already. Then at that time you are looking at infection, and it depends on which level of infection. If it's infected all the way to the bones, then we are looking at amputation, and if your antibiotics is not working. Okay, so for diabetic patients, it's not all about the friction. We want to prevent friction on the shoe, on the socks. So even on the socks, there are similar socks available. Similar socks means there's no stitching around the toe area and the ankle area at all. It's like something that just pull all the way in. So it's not compulsory, but similar socks are something that's more more created more in the past 7 to 10 years. Some have silver properties. So silver properties are like antibacterial, so that it doesn't smell so bad, and if you have a little bit of skin infection going on, it helps a little bit of that as well. Well cushioned, preferably closed shoes. So I have brought along some samples. This is one of the most recommended closed shoes for diabetic patients. They are very light. This is from Dr. Comfort. Okay, and so sport shoes highly recommended because we are looking for supportive support from the shoe. So when it comes to supportive shoes, we want that's hard behind. The cup should be stiff, so when we push it down, it doesn't go down at all. Okay, the side of the shoe should have some rigidity as well. So when you push, you can't really squeeze the whole thing in. Okay, and then when you bend the shoe, it only bends somewhere at the toe area. It doesn't fold into half. Okay. Most Malaysians, I don't know if it's a Malaysian thing or a worldwide thing, that people like to go with very flexible shoes. They can squeeze the shoe around, they can turn it, they can fold it into half. So that's not really recommended, okay? Because when the shoe is too flexible, you're actually bringing your weight back to the arch area, and you're going to stress your foot. So when on elderly patients, they don't have they don't have enough strength already, and when they push off, this kind of shoes actually help them to propulse better. Okay, so next, so this is what I mentioned just now about soft foam padding around the shoes. Okay, so it's not so much of cuts and layering around inside the shoe. So if you go with sport shoes, okay, usually they are just as good because they are well padded everywhere. So sport shoes brands, I usually recommend brands like Brooks, Asics, New Balance. Actually, it's not brand specific. It's really just that you know how to choose your shoes, the characteristics of the shoe that really matters. There's no bad shoes or perfect shoes. It really goes with which type of fit and problem that you're having, and you should go into which kind of shoes. Okay, so the gold standard, like I mentioned just now, okay, so any sport shoes, stiff heel cup shoes that is not too flexible, okay, and then a broad toe box. So many women at the older age have bunions. So if you have bunions issue like hallux valgus, like the big toe bending towards the side more, then make sure your the toe box area is big enough. So what I recommend my patients as a tip is that when you want to buy that pair of shoes, you put it on the floor, okay, you put on top of the shoe, okay, and then you want to make sure that the toe box is broader than your foot. If just by looking at this like that, your forefoot area is already covering the whole toe box of the shoe area, then it really means that when you put your foot in, you're squeezing all the way in. So trying to get something that's as broad as possible. Yeah. And so thick outsole with shock absorption material. This is what I meant, the thick outsole. So actually, it's not so much about the insole. There are many things that we can do with insoles. It doesn't. Of course, it needs to be very first try it on, but it actually, when it comes to expensive shoes, good shoes, it's more importantly is the outsole of the shoe. So when it's thick, it actually gives the shock absorption before your foot hit the ground. Okay. So next we talk about stiff joints. So some elderly, we have hammer toe, claw toes over here. Where's my? Okay, sorry. First picture, we're talking about hammer toe. Okay, where just one or two toes that's overlapping over. So as long as your shoes is high enough, or there are some material not so available, not so widely available in Malaysia, but this is like, for example, the diabetic shoe I mentioned just now. This is a lycra material. Okay, can you see that it's expandable? Or there are even like some sport shoes, this cloth part where it's flexible at the top. Okay, so that your toes have space for expansion. Don't get something that's too tight that rubs on it constantly all the time. Okay, or you wear socks that even have the toe protection, each of it. That helps as well. That helps to even prevent fungal skin actually. Okay, because elderly, they usually can't really reach their feet. So you after you shower, the water gets trapped in between the toes. So that's when you get tinea pedis, fungal skin very easily. Okay, and so the other toes where it's all stiff up like that, that's called claw toes. Again, very commonly in elderly, so stiff joints, arthritic feet. Okay, if a person has high arch, very stiff foot like that, then we don't want to go with something that's too supportive. Okay, you want the flexibility in the midfoot area. So something, then this is actually easier to find. Okay, you still want the stiff heel cup because the foot the heel is the first to touch the ground. So the moment it touches the ground, you want something that holds the grip, the ankle well. And then when you bend the shoe, it's something that bends more even from the middle, okay? But something that doesn't bend into half. If it bends into half, again, it's too flexible, then it gets stressful and strenuous just to walk. So it's a very high arch person, we usually get very stiff foot. So like all the small bones around the foot is actually stiff. So they don't have enough flexibility and range of motion to carry out the mid stance. That means the stability of the foot face. So if the person just walks heel cup, heel strike, and then in the mid stance face, because they're stiff, they just stay there, then it's very they feel tired more easily when they are walking. Okay, so stiff heel cup with flexible outsole and a thick outsole. Okay, of course, thick outsole, like I said before, it acts as a shock absorption. It gives the cushioning to the feet. So sandals, our Malaysians' favorite. Okay, sandal is something. Again, it's not the most recommended because especially diabetic foot, we want them to keep in the closed shoes because nothing can really go in. No rocks, you don't kick on anything so easily. That's the safest. But of course, with the more, if you're not diabetic, healthier person, sandals is not a completely no-no, but you need to choose the correct type of sandal. So we talk about the no-no first. So why is it that this kind of bedroom slippers and flip-flops are our biggest no? Because I'll use a good one as a sample first, because especially we'll talk about the bedroom slippers and the flip-flops together, they are very loose, okay? Most of the time, they are not well fitted. So when they wear shoes like that, they are actually hooking the shoe and walk, okay? So when you're elderly, you can't even lift your foot, you can't even dorsiflex your foot well enough, there's not enough range of motion, and you walk like that, you're actually using much more strength just to walk normally because you have to hook the shoe. Or you get tripped very easily because sometimes you just lose your strength and you get tripped at the front because it's loose. Okay, so even though bedroom slippers, especially, they're padded, they feel comfortable, but they only give the bottom comfort, but they don't give support, so you trip very easily. Okay, so go back to sandal. So you want something that, if you are looking for sandal, you will get something that's more well fitted. So when you put your foot in, there's not so much of space. Okay, it fits completely well. But if you, in terms of sandals, they're not, unless it's strappable, like you can adjust the straps here, then really have to find something that fits perfectly well. Then it's considered a good sandal. Okay, so arch support is a plus point when it comes to sandal. So it will give extra stability to the foot. People with sandals, people who wear sandals tend to have much drier skin as well, because you're exposing it all the time. So make sure you wear, you put on moisturizer daily. If daily doesn't work, twice daily. Okay, then the dry skin, you can put normal moisturizer, Vaseline is fine. Or if it doesn't work, if it's cracking, then get heel cream with urea. So just go to the pharmacy and tell them you want heel cream with urea. Okay. Thick padding, comfortable to wear. Arch support is a bonus point. So there are also this kind where it's not hook on. Okay, you just need to know where to look for. Okay, there are many sandals available nowadays. We have more options. Okay, so all right, lastly, we will talk about prescription orthotics. So this is more something that only podiatrists prescribe. I know we can get it in retails nowadays very easily. The so-called custom-made ones from non-podiatrists. The difference between a podiatrist prescribed orthotics and a custom-made one that you get in the retail is that we check your gait and we check your muscle power and everything before we prescribe the orthotics to the patient. So if a patient is stiff, we cannot give them something that is more, that's again more corrective, polypropylene hard material. We give them something that's softer. something that's slightly more bendable. So usually a elderly patient, I will give orthotics that's, so like for example, this is a diabetic patient orthotics, much more padded, okay, softer, all right, not so much about support, but more for comfort, okay. And then corrective orthotics, if the patient is elderly but still healthy and they're strong, then of course we still give them supportive and corrective orthotics, because that it helps to prevent problem from happening. So we make corrections on the orthotics to treat the patient. But if they go for custom-made ones outside that's from a non-podiatrist, what is the biggest problem is that you're bringing your problem over. So let's say you have a very pronated foot already, so your arch is usually lower, okay? Then when they make you stand on a machine and just print something off, your arch is that height. So when they give you the insole, it actually keeps you in that arch height. Or some patients have limb length discrepancy, and if normally patients who have limb length discrepancy, and if they're not corrected and they wear a pair of normal orthotics, it actually tends to get worse. So they get like back pain and all those, because you're bringing your problem over. So it's very important not to get orthotics from non-podiatrists, okay? And then what we can also do on top of when I talk about the prescription is that, for example, accommodative orthotics for elderly and diabetic foot patients, we add padding around. So and of course, any pairs we can add padding around. One of the most common padding that we add for our elderly patient are like, you know, U-shaped padding to offload certain joints that over the time they just, you know, lower, so you can feel like maybe one or two bones that's much more painful. Then we will offload that area. Or donut padding for corn cases. So if the, certain spots, the corn just grows extremely fast, and around the area we actually lift it up so that it disperses the pressure and it grows slower. So again, like I said, corn, we can't really stop it from growing completely, but it's all about managing it so that it doesn't come back so quickly. Okay, and then sports orthotics for sports patients, that we have different things to talk about. So that's all. Yeah, so we'll just an overall recap. Diabetic patients and vascular disease patients wear overall padded shoes, something that doesn't have too much of stitches or you know, in and out. I don't really know how to describe in and out thing inside the shoes. Well cushioned. And if you have reduced muscular strength for elderly patient, make sure they wear light-weighted closed shoes. And then types of feet. For flat feet, you want more supportive shoes, and for high arch foot, you want something that is slightly more flexible. And then if you have corns and calluses, again, make sure you wear thick padded shoes to make sure that they are well cushioned. Okay, that's about it. Thank you, everyone.
All right. Thank you very much, Dr. Shuang. We have a few questions from our participants. Okay. So the first one is, my son is 5 and he seems to have hypermobility of joints.
Mm-hmm.
He falls with foot in eversion. I make him do eversion exercises. Any home care recommendations? I noticed now it is frequently happening as we are all home due to COVID lockdown and we can't do much. Hope you can help.
So firstly, hypermobility is not something that we can really reverse. You're born with it. So if you're hypermobile, strengthening exercises are very important. Because you say you're doing, if you're hypermobile, most of the time, hypermobile patients are flat-footed. And then if you're hypermobile, you shouldn't be doing too much of inversion exercises. You should do more of, oh yeah, okay, I understand. So it's inverted, so you want to strengthen the inversion side of it. Something you can do is the exercises for the bottom of the foot. So one of the most common one is towel pull. So you just put a towel in front of you, okay, and then your foot just try to grab your toes to grab the towel slowly. Okay, that's one. Another one is you roll a thick towel. Okay, this one. Roll a thick towel. And then you're going to stand on both your toes, one foot at the front and one at the back. Let's see if I can mimic this. So one foot at the back, okay, and one at the front. So the one on the front, you lean towards the wall. Not leaning, just the hand on the wall, okay? And then you stand on your toes. So the one on the front where it's standing on the pig towel is dorsiflexed more at the toe and extended more at the toe as well. So you stand up and you will use a lot of your arch strength this way. Okay, so this is some extra exercises that you can do. So the one at the back foot, also stand up on the toe to support it. So go up and down 10 times, then twice a day.
Right. Thank you very much. The next question from our participant. Which brand of shoes do you recommend for flat feet?
For flat feet, again, like I mentioned just now, is more for supportive shoes. So sport shoes are the most recommended ones. Sport shoes running series especially. It can be training series, but not so much a walking series, because walking series shoes, they are usually very thin on the outsole, more for sleek looking, of course. So not so much on walking series, unless the walking series comes with thick padding. Brands wise, I mentioned as well just now, for sport shoes brands like Brooks, Asics, New Balance, but it's really not about the brand. It's about the specific shoe and characteristics. Like brands like Nike and Adidas, I stopped recommending because they are so fashionable nowadays, and they come up with a lot of like, for example, NMD's cloth on top. They even come with a little bit of heel support actually. So that if you're not wearing other orthotics together with it, then that's not really a problem. Make sure you have the heel support and the bending. But some of the NMDs or Nike shoes, MX is not really, MX are still quite supportive, but NMDs, they are like curved. It's like a rocker bottom kind. So again, you're forcing your arch in the middle side because it's soft. It's a soft shoes, and then you bend, you're just holding the foot back to the arch area again. There's another brand called, oh dear, I suddenly forgot. I forgot the brand, but it's basically it's available in the Curve KL. Curve, yes. It's a rocker bottom shoes. I forgot the brand of it. Yes. So basically that shoe, not very good for stability talk that we are talking about, but some patients with you're strong, the flat foot, it helps with it. So it's like it helps with when you land the shoe, actually you are landing extra on the dorsiflexion side. You actually dorsiflex your foot immediately because the shoe is already like that. So you land this way, okay? Then it helps to roll forward. So rocker bottom shoes are not for unstable patients, but you can try if you're flat-footed or some knee pain issue, can try that as well.
Okay. Can you give us tips on buying the right insole?
Like I mentioned just now, if you're looking for custom made, then go with a podiatrist. So any podiatrist, we have few in Malaysia now. That's when we give the best advice, because we will check every patient's gait. We will do a full biomechanical and gait assessment before we prescribe the patient. So when it comes to insoles, definitely go with a podiatrist. But you can, if you just want to try how an insole feel like, then you can try the off-the-shelf ones. So usually the off-the-shelf ones are a little bit stiff. Then it's just like an arch support. The generic, it goes by sizes. You can try that. There are also silicone insoles. Silicone insoles, you can see it's available in pharmacy more readily. Silicone insoles are more for like if you have only con and calluses issues and sports patients, they like silicone insoles as well.
Okay. And our next question, for patients with obvious limb length discrepancy, is there any customized shoes that really helps? Apart from footwear, any other conservative way to correct it, and usually how long does it take?
For limb length discrepancy, we work closely with chiropractors. So because if you are having LLD for a certain period of time already, your back muscles tend to get tight on one side. So physio and chiros will work will help a lot in this case. So at that part, I actually refer, like in terms of exercises and in terms of link discrepancy, I actually refer to chiros and physios to help me with it. But in terms of shoe wear, so of course shoe wear will help because you want to, whatever you do in the chiro and physio side, it helps to maintain it with the shoe wear. Otherwise, if you're back to normal again, on every single step that you do, then no matter what physios and exercises you get your treatment over there, it's not going to work. So shoe wear wise, still have to look at which foot type is he or she is. So then recommending based on like the normal, how we would go with flat feet or high arch. But we make extensions in the shoes. So there are a few cobblers that do a really good job in KL, where they cut off some parts of the shoe. Well, if we talk about kids, like they usually the parents will bring me a few pairs, and then we'll just correct it for them. The side that is shorter, then we will add the height to it. So one thing more technical that I can share here is when we get the limb length discrepancy of the patient, for example, a 2 cm, and this limb length discrepancy is something that we actually measure just by the patient in a supine position, non-weight bearing. Because if you use the X-ray one, let's say the patient really have a bone length discrepancy, the X-ray one is actually not very accurate in the sense that the patient will compensate. So once they compensate, the length is different already. So use the one that what you measure. Then you divide it into two. So let's say the patient has 12 mm limb length discrepancy, then we will usually give a heel lift of about 6 to 8 mm. So don't go with 10 mm because you need to give room for improvement and compensation to happen. So we will add, to answer that question, we add heel lift to the shoes. Yes.
Okay, and we'll take the last question from our participant. Dr. Shuang, what's your advice? What advice do you give if the patient has Morton's toe, and which type of pads do you recommend?
So Morton's toe, there is something as Morton's pad. Okay, basically it's like a round little triangle pad like that, and we usually insert it into apply on our orthotics. I think this one has a Morton's pad in it, but it's probably not very clear. Can you see this round bulging thing here? So we can give just the pad to our patients, but usually the effect won't be as good as a full prescribed orthotics and then adding on the pad onto that, because then we are making sure that when the patients put this into their shoes, the pad is where we want it to be. So what the Morton's pad does is that it opens up the space in the foot so that so you push and you open up the space so that the bones are not rubbing against each other, so that the neuroma gets to rest, the lesion in between the toes gets to rest. So again, this is a conservative method. It doesn't take away the lesion at any means. It just helps to prevent the pain. Yeah.
All right. Thank you very much, Dr. Shuang.
Thank you.
We will proceed with our next speaker for today, the last speaker. Let me introduce you to her. Yeah, okay. So our final speaker for today is Madam Nitya Kumaravel. Okay, so Madam Nitya developed a passion for the ancient ways of natural living, alternative medicine and therapy since 2009. She first learned Hatha Yoga from Dr. Raghupati in Penang and continued studying as a yoga instructor from the Malaysian Association of Yoga and the International Teacher Training course in Sakti School of Yoga under the guidance of Master S.K. Durai. She also has skills for fertility, pre- and postnatal yoga. She received certifications in alternative medicine, including Diploma in Todu Varmam from India and certification as a Reiki master. Currently, she is studying the effect of Siddhas Mudras, which is an alternative medicine, and also has completed a course on yoga-related therapy for autistic children. She is also an assistant director with the KL State Education and is in the midst of completing her PhD in learning sciences. She has been a secondary school teacher for the last 13 years and a yoga instructor for 7 years. Being passionate in educating people on a more natural way of living, she is constantly pursuing avenues that will bring this to as many people as possible. With this, I present to you Madam Nitya.
Hi, Namaskar. Thank you, Arti, and thank you, Dr. Lim. Okay. Thank you. So how do I share my screen, yeah? I just share it from here, is it?
Yeah, you can just share from there.
Okay. Okay. Good morning to all participants. I cannot see all of you because I think you have turned off the video already, but it's okay. Hi, my name is Nitya. So today I'm going to Namaskar everyone. Namaskar. Okay. Normally when I do my yoga classes, I will on all my video, but it's okay. I think I have to talk alone here, is it? Okay, so today I'll be sharing with you how to find your stability with the practice of yoga. So with this, today during my session, I'm going to share with you what is the yoga, a very short theory, and I'm also will be sharing with you some of the benefits. Okay, and practically I'll be showing to you, guiding you also to do joint exercises, Surya Namaskar or Sun Salutation, and I will show you some of the balancing asanas. And as a bonus, I'll be sharing with you breathing exercise. Okay, for all of you to practice. Not only today, but also hopefully you can make it as a daily practice. Okay, now when you are looking at my next slide is why yoga, so don't get surprised. Okay, relax. Okay, so I just try to make easy for you. Okay, yoga, definitely all of you have heard the word yoga. Okay, you have seen it in IG, social media, or people are performing it, or maybe some of you are joining yoga classes. But but mainly, I just want to share with you, yoga is not about executing the asana. Asana meaning posture. Okay, but it's also about bodily movement method that also enable prana or life force to be distributed equally to each and every parts of your body. So if you can see in the picture itself, okay, I just want to show you briefly only. I won't go deeper into it. There are 5 types of vayu that circulate, is seen to be circulated in our body. Okay, that would be udana, prana, apana, and vyana vayu. So as you can see, for those who are having balancing or stability problem, mostly is focused on the apana, the lower part here, which is started from the pelvic girdle until the toe. Okay, so for those who don't understand how the yoga works, okay, let me bring you one situation. When you feel down on a certain month, sometimes you feel that you want to go for a Thai massage, Bali massage, or any type of massage. You want to feel good, you want to go to spa, you want to get relaxed. Okay, for example, I focus with the massage. You close your eye and relax. So what the person does, the masseur will do what? The masseur will massage your body based on the point. They don't simply massage, they don't simply put their fingers, their hand on your body without knowing which is the vital point to be pressured so that it can give you benefit to your body. Okay, and also they will know which the meridians they need to massage, okay, so that can give maximum benefit to the person itself. Okay, then after your massage session, how you feel? Some of you may feel asleep, and after the session you feel relaxed. Okay, let me bring your attention from massage to the yoga practice. Okay, yoga is a conscious movement, steadily bodily and conscious movement, whereby you are consciously moving your body into certain postures. At the same time, you are bringing the enough prana or life force, in the sense that from your breathing, when you are inhaling, okay, as you see in the screen itself, the prana sakti or the life force will be distributed through the movement equally to each and every parts of your body. Okay. Now, at the same time, what happens to your body is that you are unknowingly, you are massaging your body and also the internal organs in your body. So I just keep it to that side first. Okay, now the practice of yoga itself able to detoxify your body, not at the skin level, but also from the nerves itself, such as clearing the blockages in your nervous system that also may cause illnesses, pain, and also immobility to yourself. Now, let's look what are the benefits of the yoga itself, okay, compared to traditional form of exercises like aerobic or anaerobic exercise. Okay, yoga is relatively a low impact exercise, but also modifiable in nature, whereby it can offer a middle ground for individuals' limitations, clinical diagnosis, and particularly suitable for aging population. Now, yoga, what differentiates yoga with other exercise regime is that yoga also incorporates, okay, not only physical but also mental exercise, such as like mindful meditation and also breathing exercises. Now, with this combination, okay, physical and mental and breathing exercise, it does in fact gives a positive impact for an individual, either via physical level, psychologically, and also physiologically. So if I'm saying like physiologically, okay, this combination also, okay, demonstrated to give positive effect, okay, or impact in the reduction of blood pressure, improve cardiorespiratory fitness, and then myocardial perfusion, serum cholesterol, upper limb muscle endurance, and the most important thing is that body flexibility, balance, and also can increase the bone density. Okay. Now, let's look at the similar why yoga is okay, like why, like in physiotherapy, like there are many studies that have also suggested, okay, the use yoga exercise as to improve one's mobility and also stability and also for balance. Okay, it is also said from many researchers, medically and scientifically proven that yoga exercises also can affect various body structures and systems such as musculoskeletal, nervous, visceral, endocrine, and immune system. Okay. Apart from it, it will also benefit patients with neurological, orthopedic, metabolic, psychosomatic disorders. Okay. In addition, body structures such as cells, tissues, and organs can be influenced also simultaneously with one entire system, meaning that through the movement, through the taking in the prana or life force itself, and you are igniting, you are distributing the prana sakti to each and every parts of your body, meaning that each and every cells and the systems and also the tissues, everything getting the maximum benefit from the movement itself. So if you can see, I've just shown you a simple model from a study done by Talos and Nevin in 1997. So they have stated about the similarities between yoga and physiotherapy on the conceptual level itself. That both yoga and physiotherapy have the similarity at the level of psychological, physiological, spiritual, social and educational dimensions of human health. Now, this morning, I'm going to show with you, now we go into the practical session. Okay, so I'm going to show you one of the important exercise series of Pavamuktasana. Okay, Pawamuktasana is a joint or wind releasing exercise. Okay, this is also a subtle exercise that releases physical and mental energy blockages and tone the body mind for deeper practices. This is quoted from Swami Satyananda. Okay, why the Pawamuktasana? Pawan meaning wind releasing exercise from the joint itself. Okay, for example, imagine you are waking up in the morning. Definitely you feel the stiffness in your body. Okay, it could be like lactic acid or because the way you are sleeping. But you can remove this so-called wind from your joints through this very simple exercise. But today I'm going to show you by using chair, because I assume that most of you, okay, you are sitting in front of computer and maybe you are working longer time on at one place, or maybe some of you have difficulty to sit down. Normally we do this exercise on the floor, but today I'm going to show you using chair. Okay. Can I enlarge my, can I pin myself? Arti?
Yeah, sure, Ms. Nitya.
Okay, so I stop share. Okay, how to pin myself? That means I already pinned myself, is it?
I think the spotlight is on you.
Okay, okay. Okay, so I assume that maybe most of you are sitting on the chair because you are. Okay, today you will be joining me. Ihang, okay, Ihang, I think you'll be joining me today. Okay, very good. Now, okay, so we start from the toe itself. So this exercise you can perform anywhere, anytime. Okay, so let me show you. Okay, from the side, we start from our toes. Okay, just bring your foot up on your heel. Going to open our toes. Open, close, open, close, open, close. Now bring your feet towards your leg and bring it down, and then bring it on the toes, and then bring it up like this, and then bring on the toes, lift up on your toes, sorry, and bring up on your heel, and then bring once more on your toes. Okay, and then release. Let it be on the floor. Now, what you're going to do, open up your leg. Okay, so I have to use this chair so that to show you different angle, yeah. So now bring both of the legs to the center. Bring both of the feet to the center. Then you do rotation to the side. And then bring it back to the center, rotate. And then bring it to the side. Okay, one more time. You can hold the side of the chair and then bring it to the center, and then bring your feet to the side. Now, sit comfortably. Okay, now we're going to lift up our leg. Okay, so we start with the right leg. From your knee, just lift up like this. Stay there. 1, 2, 3, 4, 5. Now bring it down. Now we lift up one more time. Right leg up. 1, 2, 3, 4, 5. Bring your leg down. Okay, now we're going to lift up your left leg. Now bring it up. You are now compressing your knee. Okay, keep it up. 1, 2, 3, 4, 5. Bring it down. Okay, one more time. Keep it up. 1, 2, 3, 4, 5. Okay, slowly bring it down. Now, you bring your right leg up and place it just above your knee. Bring your right leg up, just place it above your left knee, sorry. Now, your right hand, place it on your left knee. Inhale, exhale, push down, exhale, release. Inhale, sorry, push down, exhale, release. Now inhale, push down, stay there. 1, 2, 3, 4, 5. release. Now, we're going to do hip rotation. We're going to do hip rotation. Okay, it's very easy. You go twice on the clockwise and another twice on the anti-clockwise. So you just hold your feet like this. Okay, so bring it down. Just push it down. Bring it towards your body and then bring it up. Bring it down, bring it towards your body, and then bring it down. Now we go anti-clockwise. Now bring it down, bring it towards your body. Okay, one more time, do rotation. This one will make sure your pelvic rotation will be done and the blood flow. There's a proper blood flow to your lower body. Now bring your right leg down, bend your left leg. Okay. Bend your left leg. Place your left hand on your left knee. Inhale, push down, exhale. Inhale, push down, exhale. Feel the tension. Inhale, push down, stay there. 1, 2, 3, 4, 5. Now we're going to do hip rotation. We're going to do hip rotation. So we go clockwise first. Now push your leg down and then bring it up. And then push your leg down one more time, bring it up. Last time, bring it down. Now go anti-clockwise. Okay, bring it up. 1 and 2. Okay, release your leg. Okay, put it on the floor. Make sure your feet is stable fully on the floor. Okay, now what we're going to do? We're going to do hand exercise. Bring it forward. Okay, your hands must be straight like this. We're going, okay, bring it forward like this. We're going to spread your fingers like this. Open, close, open, close, open, close. Now bring your hand up, down, up, down, up, down. Now make fist. Bring your thumb inside. Close your thumb. Okay, bring it forward. Make sure you don't bend your elbow. Now we're going to do rotation. Bring it to the right. Bring it down, up. Bring it to the right. Go down to the left and bring it up. Now bring your hand to the left. Go down to the right. Bring it up. One more time. Go down. And then bring it up. Very good. Now bring your hands to the back. As if you are pulling, bring both of the hands just like this. Imagine that you are pulling a 10 kg of load. The 10 kg of load could be your worries, anger, negativity. If you feel down because of your immobility or imbalance, okay, just take it off from your shoulder. You must be living in a more positive life right now. Okay, take it everything easily, but live in a positive life. Now, bring it forward with assertion as someone holding your hands back. Bring it forward with assertion. Okay, slowly bring it forward and release. Let go. Okay, one more time. Bring your hands back. Pull with assertion and then bring it forward. Breathe normally. Bring it forward. Release and let it go. Now bring your hands at the side. Pull from your shoulder. Pull with assertion. Actually, you are working your tricep and also your bicep. Open up and release. Now one more time. Pull with assertion. Come on, you can do it. Just release. Open up and release. Now bring your hands up like this beside your ears. Hold your index and middle finger. Hold your index and middle finger. Now open up your chest. Okay, look up in between of your eyebrows. Stay there. 1, 2, 3, 4, 5. Exhale. Bring your hands down. One more time. Rotate. Bring it up. Hold your index and middle finger. Open up your chest. Look up in between of your eyebrows. Stay there. 1, 2, 3, 4, 5. Exhale. Bring your hands down. Now do rotation on the other side. 1 and 2. Very good. Now we're going to do head exercise, which is very easy. Now inhale, sit comfortably. Okay, shoulders are dropped. Okay, you must be open up your chest. Don't concave like this. Open up your chest. Your spine must be erected. Okay. Now inhale, exhale, down. Inhale, center. Exhale, down. Inhale, center. Exhale, move to the right. Inhale, center. Exhale, move to the left. Inhale, center. Then tilt your head to the right and up. Inhale, center. Then tilt your head to the left. Very good. Come back to the center. Very good. Now we're going to do eye exercise. I will come down. The rest of you just sit on the floor. Okay. Eye exercise. Nowadays, lots of you, all of the rest sit on the chair. I just come down. Okay. Now, eye exercise is a very beautiful exercise for everyone. Okay, this eye exercise, okay, is very good for your eyes and also will give you a good stretch the muscle inside the eye. At the same time, activating your sensory organs and also stabilizing your internal emotions. Okay, and I know most of you are using computer, you know, you are using the smartphones, and you can teach this eye exercise to everyone, including children. Okay, because I think nowadays children, most of them are using these electronic gadgets without knowing that it will be harmful to their eyes and also later on their nerves. Okay, now just take out your glass. Okay, we only going to roll our eyeballs. Remember, we only going to roll our eyeballs without shaking our head. All right. So let's make a challenge for us. Okay. Bring both of the hands together. Now you should be focusing on the eyeballs. Sorry, on your tongue. On your tongue. Okay. Sit comfortably. If you're on the chair, just imagine that I'm sitting on a chair. Okay. Now bring both of the hands together, breathe normally. Now slowly bring your hands up, look up, and then slowly bring your hands down, look down. Now bring it to the center. Now bring your hands to the right while bending your elbow. Now bring it to the center. Feel the stretch inside your eyes here. Now bring your hands to the left while bending your elbows. Now bring your hands to the center. Very good. Now bring your hands down to the right knee. Bring it up diagonally to the left. Now go down one more time to the right. Now bring it up diagonally to the left. Now bring your hands down to the left, down, and then bring it up diagonally to the right. Now go down one more time to the left. Okay, bring it up diagonally to the right. Now bring your hands to the center. I'm going to do 2 circles, 2 on each side. Okay, we start from the right. Okay, do 2 circles starting from the right. Okay, slowly make a big circle in front of you. This is one from the right, and then the other side. Okay, I bring it to the center. Now we go on the other side. Okay, slowly. Okay, and then no rushing. We are not catching any breath. Just do it slowly, relax. Okay, bring it to the center. Now slowly bend your elbows, bring your tongue towards your nose tip. This one we call Nasiga Dristi. Stay there. 1, 2, 3, 4, 5. Now bring forward, straighten up your hands. Now bring it up, bring it in between of your eyebrows. You are looking up. Okay, stay there. Now you are looking now like a Wonder Woman. Okay, stay there. 1, 2, 3, 4, 5. Now close your eyes, release your arms. Place your palms on your knees, palms facing up. Relax, close your eyes. Relax. Relax and feel the sensations on each and every joints in your body. Imagine there's a golden light enveloping each and every joints in your body. You feel the warmth from the energy. It's all from your imagination that will manifest. The imagination that manifests into a golden energy, at the same time healing yourself. Right? Now, and smile. Very good. Very good. Now, very good. Thank you very much, Ihan, Daphne, Prasanta Rao, and Mahadevi, Dr. Mahadevi, Madam Mahadevi, and Aarti. Very good. Now, when you are doing this exercise, we call this as Power Muktasana exercise, okay, then you can do any form of exercise, will be easier for you. Okay, remember the wind releasing is not only keluarkan angin, it's all okay, releasing wind, but at the same time clearing up toxin from your body. Okay, and at the same time will make your body more alert, and it's also a way of healing your body. Okay, now let me share with you other slide. Sorry, 1 minute. Next, okay, I want to share with you another beautiful exercise. How to enter? Okay, we call it as Surya Namaskar or Sun Salutation. So Surya Namaskar or Sun Salutation is an ancient way of exercise that includes 12 steps on each side, meaning that right and left. Okay, it is an alternative way of movement that include various of transitions between flexion and extension during Surya Namaskar, during the practice. Now, this practice also holds massive potential. Later on, I will show with you the scientific studies they have done that have also concluded the benefits from performing Surya Namaskar, especially for those who are having mobility or stability or balancing problem. Is one of it is to, it will increase the mobility of all the body joints with the stress on anterior and posterior soft tissues, and also challenging postural balance mechanism through a very base of support. So with this, okay, let me start with Surya Namaskar. I will do it slowly. For those who wants to do, please do. Of course, I cannot view you from here. I cannot access you from here. Just do one step at a time. I'm sure this session is recorded. If you want the video, you can maybe you can ask from the admin. Okay, come. I will show you how it works. Okay, come. Okay. We don't need check. Okay. So I use a yoga mat. Okay, anti-slippery yoga mat. Okay, you can use on the floor. You can use the floor, but the problem is when your board hits the floor, you feel the pain. So better use yoga mat. Yeah? Okay. So to stand, your leg must be 8 feet apart. Your leg. I come here today. 1 minute, I adjust my camera. Okay. Now, your leg must be 8 feet apart. Okay, come to the front of the mat. Okay, stand straight. The important rule to be stabilized, to stability, is standing right. You cannot hunch forward. You cannot hunch forward like this. So you must stand straight. Okay. So that's why before this they have offered different types of shoes, okay, and correction photos. It's all start for standing properly. Actually, if there's any youngsters here, if you can start standing properly, straight line will be beneficial for you in the future. Okay, now come to the front of the mat. Hands in Namaskar Mudra like this. This is the Namaskar Mudra. Okay, now inhale, bring your legs up. Now exhale slowly, come down. Hands at the side. Look forward. Now bring your right leg to the back. Bend your right knee. Bring it down. Inhale. For those who don't have stability, you can put your both of the hands down. Or if you want to test your stability, body up. Project your left knee forward. Try to stabilize yourself and then bring your hand up. Exhale, bring your hands down. Bring your left leg to the back. Now inhale, tuck your toes. Exhale into mountain pose. Okay, this is mountain pose. Now knee down slowly, and then slowly bring your chest and chin down on the floor. This is a circle. Now straighten up your leg. Exhale. Inhale, bring your body up into cobra pose. Elbows are bended at the side of your feet. Look up, pinky on your elbows. Now exhale, push your body down into jump pose. This pose also is a good pose for those who are having stress and also emotional turbulence and also who are having high blood pressure. Now inhale down. Tuck your toes, exhale into mountain pose. Now from here, bring your right leg forward. Inhale forward. Bring your knee down. Either you can sit with both of the hands down and forward, or else project your right knee forward. Bring your point of stability. Now bring your hands up. Exhale, bring your hands down. Now bring your left leg forward. Hands in namaskar. Inhale. This is the sound on the right side. Now exhale slowly come down. Hands at the side. Now we are going to do left side. Bring your left leg to the back. Now find your stability. Place your hand like this. You can stay here. But if you are more confident, you want to challenge your stability and balance, come up. Push your right knee forward. Inhale, bring your hands up. Stay there. Exhale, bring your hands down. Bring your right leg to the back. Inhale, tuck your toes. Exhale into mountain pose. Very good. Now bring your knee down slowly. Now bring your chest down and chin down. Into Asana. Now step it up. Inhale, bring your body up into Jangasana. Exhale, push yourself down into the jump pose. Now inhale. Come on. Tuck your toes, exhale into mountain pose. You push your heel up. Every time you come into mountain pose, you push your heel up. Some of you maybe have a difficulty to put both of the feet down. It's okay. Just bend your knee one at a time. One at a time. Okay. And then you can put your feet down. Okay. Knees must be straight. Shouldn't be bent at this level. Now, straighten up your leg, down, inhale, recovery. Now, bring your left leg forward, bend in. Again, you can put your hand down, yes. Project your left knee forward, bring your hands up. Exhale, bring your hands down. Right leg forward. Hands in namaskar, right leg, exhale. Okay, for those who, of course, some of you cannot put your hand on the floor. It's okay, you can start from here. Okay, you can place your hand like this, and then you can go into the pose. It's okay. But as you progress, you will notice you have more stability, at the same time, more flexibility to go to put your hands on the floor. And I've seen it on, so that's the end of the Surya Namaskar. And I've seen it like most of the my students, older elderly people, no need to go elderly people, I'll tell you. I've seen teenagers who have stability problem. Okay, and also 20s, 30s. Okay, nowadays what I believe is that stability doesn't belong to the elder age. It starts from the younger ages itself actually. From the way you are standing, from the way you are sitting, from the way you are walking. So these are the things that we need to look into. But through the practice of yoga, it can be corrected. Okay, we have scientific research on it, thousands of papers on it. So maybe you can find it in the PubMed. You can just search, you can just Google for it. Okay, now the next one I'm going to share with you what are the benefits from doing scientific benefits in doing Surya Namaskar for physiotherapy. So if you can see here, these are some of the findings, scientific findings that I have gathered. Okay, if you can see a significant increase in muscle strength and endurance, and decrease in body fat, definitely, and improvement in fatigue, balance, guide speed, and also stride length, reported using clinical measures, improvement in balance, as well for people with neurological disorders. Okay, maybe can be enhanced due to joint positions. Okay, next we can see the increase the mobility, improve strength and mobility, and finally it has also Surya Namaskar also been recommended because for the physiotherapy owing to its huge potential as a single complete exercise to enhance flexibility and postural control. Okay, now as you can see here, I'm just showing you the differences. Normally, like for elder people, we say easier you go for walking. Okay, of course, walking is good. Depends on you walk like you go to pasar or you do brisk walking is up to you. Okay, now so moderate walking. One research mentioned that moderate walking of 2 kilometers at least 2 to 3 times per week is shown to have improved postural sway. But when we comparing it to Surya Namaskar, it has 18 times higher, greater vertical displacement of control of mass than walking, challenging postural control mechanism to a greater extent than walking. Okay, now today, next I'm going to, before I end my session, this is the second last, I'm going to show you some balancing asanas for those who cannot get into the floor, cannot sit down on the floor. Sometimes they need someone to raise them up so that they can stand up properly. Okay, the first one is Vrikshasana. Vrikshasana is a tree pose. Okay, okay, 1 minute. How to stop share? Okay, come. Okay, like Vrikshasana is a tree pose. For like normal people, I won't say normal people, my students in 20s and 30s, they have a problem in their balancing also. For example, if I ask them to stand like this, just like this, okay, this is the basic Vrikshasana. So your feet shouldn't be on your knee joint. Shouldn't be at the side of your knee. Should be below or above. Below or above. Okay? This is a tree pose. It can enhance your focus and stability and balance. For those who cannot bring your leg up to this region, it's okay. You can still place your leg here, hands in Namaskar Mudra, just like that. Okay? And then you can use the wall. Okay, you can use the wall as a support. Okay, now I'm holding the wall for support. I'm bringing my leg at the side like this. You see, I'm bringing my leg at the side like this. I'm using wall as support. I can just stay there. So for more stability, I just bring nearer. I try to use the wall as support. Okay, then I can just lift up my hand so that I can improve my balance over here. Then I will. Okay, next. Okay, I'm going to show you the Trikonasana. This is also one of the balancing exercise. For those who easily can topple forward, you can use wall as a support. Okay, just open up your leg, hands at the side, inhale, exhale, bring your hands down and up. This is the Trikonasana. When you are doing this posture, you see, when you are doing this posture, this is Trikonasana, bring up, look up, open up your chest, you will be bringing your chest down. Open up your chest and look up. Okay, what? This Trikonasana may look simple, but this is the most important pose for stability. And at the same time, you are massaging, as I told you before, your internal organ, your right and left side organ. Okay, next you can use your wall, the wall as a support. We're going to bring Virabhadrasana, bend one leg. Okay, and then I go forward and bring my hand up and down. I still can use more for support and down. And then I release from the pose. I come up straight. Okay, now let me show you. Okay, apart from this, actually we have nearly many asanas to show to you. Okay, the last one I'm going to share with you is these asanas. Sorry, 1 minute. Okay, the last one. Okay, if you want to test your coordination and balance from here at the sun, you can drop your, this is my right hand, you can drop the other hand, bring it up. You can challenge your balance and stability and coordination. And then bring it to the center, look forward, straighten up your knees, and then come back to the center. You always can use wall for support, but in my classes, majority of the people who comes with stability, balance problem, they rarely use wall. They rarely use wall. They try to be on their own. Because yoga builds their self-determination. When they're able to go into certain pose, they doesn't require them to any types of like holding or supporting. It builds their self-determination actually. They feel like good. They feel good actually. So now I'm going to share you like some of the other posters also that you can do at home. No, before that, okay, this one I keep it to the last. Okay, these are the other poses that you can do. Okay, you can use chair also to support, and just now I show you the wall as for support. You can use belt also, yoga belt for support, and also pillow. Lots of supportive tools that you can use here. Okay, this one like for the spine, opening up the shoulder blades. Okay, and your shoulders is good for cervical. Actually, cervical people with cervical spondylitis, these exercises are very good for them. Okay, this one, but this one quite the lifting up leg. I think you can focus on the gray hair lady over here. You can get it from the internet. There are lots of poses. Okay, yoga poses, assisted yoga poses. Okay, so these are my references. So as I told you, I just want to share with you one benefit of one of the pranayama breathing exercise. Okay, you see, people will, I'm looking at the psychological part, the stress management part for the elderly people. I won't say elderly people, also for everyone, okay, who are having stress, who are like clouded mind, they cannot think properly, or they don't have ideas, or they don't know what to do, they don't have any choices. Anything that keeps them down, their moral is very down, they can do this primary pranayama. As you can see, got lots of benefits over here. Okay, you see stimulates pineal and pituitary glands, remove anger, can cure insomnia which is quite common for the elderly people, and also young people. Don't get surprised. I got lots of my students who's younger, they are having the insomnia problem. Okay, and then treating thyroid, and then stimulating, you see, parasympathetic nervous system. Okay, brings peace to mind by reducing stress level, and it also can improve their productivity. Okay, it's very easy. Okay, I stop share. This is my last sharing for today. Okay, now sit comfortably. Okay, drop your shoulder. Okay, you see how I do first. Okay, we're going to close. You see, there's here we use this one. I don't know what's the name. Just to close this here. You use your finger. I don't know this name. Sorry, to close the ear like this. Okay, so I just place it outside first. I don't close my ear. Okay, when I inhale, exhale using my nose. I don't open my mouth. Now I'm not because I'm talking. Okay, so all of you, you just open slightly because to release the pressure. Just slightly, don't open up, don't gape your mouth. Okay, now place it at the side. Don't close your ears first. Okay, place it as it. Now inhale, you do a long deep inhalation until your lower abdomen expand, and your chest expand. Close your eyes. Now close your ears using your fingers. Now release with this sound. And then release and relax. Look down, close your eyes and breathe normally for a few times, maybe 2 or 3 times. Inhale, exhale. Inhale, exhale, inhale, exhale. Okay, now look up. We're going to do this sound. When you're doing what happened? You feel like there's a sensation happening in your brain. Okay, come, let's redo for second time. Place it here. Okay, now inhale. Close your ears. Then open up your ears, close your eyes, look down, breathe normally. Relax, breathe normally. Relax, breathe normally. Now look up, open up your eyes. Okay, so as you can see, I brought you through some of the process that you will go through into a full yoga session. Okay, this is not considered full because we got another one which is called Yoga Nitra. So as you can see, I have shared scientific findings with all of you, the benefits of yoga. Okay, and I want to share with you another thing, that yoga is universal. It's not related to any type of religion. It is independent and it is individually can stand on its own. So anyone from any background, race or faith or belief can practice yoga. Thank you very much. Physiotherapy team, I don't know your full name. Okay, thank you, Arti. So I will end my session now. Thank you very much. Namaste, everyone.
Thank you very much, Madam Nitya. That was very, very informative. Thank you very much. We have run out of time and we have come to the end of our webinar. If there's any questions anyone would like to ask Madam Nitya, please put it in the chat box and we will definitely get her to answer those questions. Also a reminder to all the participants, what all the speakers have mentioned. It is very important for all to be safe and always good to be assessed by your physio or your doctor first if there are any issues or problems before starting off with the exercises that have been taught. Yeah. There is a question by a few of our participants. How long, Madam, how long is the humming?
replying her. Okay, when you inhale, you must remember you inhale until your lower belly expand. You shouldn't be inhaling until here. This is where your prana sakti is stuck. You inhale, you must feel your lower belly expanding, followed by your chest. Then when you say meaning that until you feel like out of the breath, you stop.
Okay.
That's all. There's no
Thank you.
count at all.
And then
For those who are having bigger, I mean, they have the chest, their capacity is very high. The what we call the lungs, the capacity is very good. Means they can retain for longer. For those who have, you can see the difference when you are doing the Surya Namaskar and you are doing this pranayama. Then, as time goes by, you can see the increase of your lung capacity as days goes by. Okay. Do 3 times, one session, one session 3 times is enough. Yes.
can people with back pain do some of the asanas like Surya Asana?
Can recommend it.
Okay.
Recommend it. But remember, whenever you are doing the asana, know your pain first. Know your pain first. Okay. If it is dull, it's okay. But if it is pricking pain, please stop. Don't force yourself. So you must assess your pain. But for my students, this is Surya Namaskar is a great boon for those who are having a sciatica and also lower back pain.
Okay. Thank you very much, Ms. Nitya. There are actually a few more questions from our participants, but due to shortage of time, we will not be able to answer all of them right now. So we have come to the end of our webinar, and we hope that we have been successful in bringing you what all of you have want. Thank you very much, Madam Nitya.
Aarti, sorry, I just saw one comment. They said, can the stroke patient do this? Yes, better. You see the benefit. And then I think I've discussed with all of you, right? You can share my slide with them. So the video also you can share with them. So it's only for the educational purpose. I know I don't mind for it. So for, maybe those who wants my phone number, they want to have a specific video on this also, you can share them my phone number, then I'll send it to them.
Sure. Thank you very much.
Okay.
So we will definitely share her contact details with all of you. And so we have come to the end of our webinar. We hope that we've been successful in bringing all of you what you have wanted.
Sorry, Ms. Aarti, can I just add a few things?
Sure.
Probably there's one more question on the inhalation. Maybe Madam Nitya can answer that. I heard somewhere that inhalation should be through one nostril and hold 4 counts. Are you able to read that question, Ms. Nitya?
Inhalation.
Ms. Nitya, I'll read you the question, yeah? Does pranayama involve nostrils? I heard somewhere that the inhalation should be through one nostril, hold for 4 counts, and exhale through the other nostril, 4 counts, and so on.
Okay, this one different type of pranayama. This one we can call it as alternate breathing. This one if retention happens over there, this one we call Kumbhaga pranayama. We have Anuloma, Vinuloma, Kapalabhati, name it. This one is the retention happens. This one could be either if one type of retention happen. Okay, from the nostril. In yoga, we are not exhaling from the mouth. Remember that only from the nostril itself. Okay, when you inhale one time, you do retention, this one, and then you exhale from the both nostril. That one we call Kumbhaga. If we do one by one, Anuloma, Vinoma, and we merge it together, we can do Nadi Sodhana. There are lots of types of breathing exercise. Okay, thank you for the question. Thank you.
Okay, I'm just going to, this is Mahadevi, lecturer from UTAR. I'm just going to add to the 2 questions asked before. Our speakers had to leave. Ms. Joanne had to leave because she had another appointment. One of the questions was on the 5-year-old child who was, I think, tripping and had flat feet. So normally what physiotherapists do as well is because some of these children may have to get the sensory integration assessed, which basically means how the 5 senses are integrated and how the child is using it. It's a fairly simple assessment and the physiotherapist can do it. If let's say any of the components are a little bit missing or need some training, the physiotherapist will be able to give you some training. If not, they will also refer to an occupational therapist. So it may be slightly more to do with the feet. It may also have to do with maybe some tight muscles of the hip, maybe some weak muscles of the hip as well, especially if the child hadn't spent too much time on the crawling stage. Okay, so it may be just a little bit of an assessment just to get the child on the right path. Okay, and the other question was actually on the leg length discrepancy. So again, this leg length discrepancy may not be a real leg length discrepancy. In my experience, let's say in a year, I would get so many leg length discrepancy complaints, and okay, out of the hundreds that I see. So what happens is, again, with the pelvic area as well, you might have tight hip muscles and weak hip muscles, and this you may use to compensate why one leg seems shorter. That could be a habit, that could be a posture, that could be how you're doing things. It may be a bit one-sided. You may prefer one side of the body, causing more tightness on one side of the body, and therefore leading to a feeling of leg length discrepancy. There might even be something, I wouldn't call it scoliosis, but the spine may have just tilted a little, again, out of the habit, out of the posture, out of the imbalance of the muscle and all that, that in the end leads to a feeling that one leg may be longer than the other. If you do a very quick assessment, you might even measure a leg length discrepancy, but in actual fact, it may not be a real one. So again, an assessment with a good physio will tell you whether it's an actual leg length or whether it could be musculature as well. And again, there could be a combination. Somebody's leg length discrepancy may be 4 cm, but the actual one may only be 2 cm and may not need any real adjustments to the shoe, but maybe some orthosis. So again, a proper assessment by a physio would be excellent actually. Okay, sorry, I just wanted to add that. Thank you.
Okay, thank you very much, Ms. Mahadevi. So on behalf of the physiotherapy department, I would like to express our heartfelt thanks to all our esteemed speakers for today who shared so much of insightful knowledge with all of us. Also to Professor Dr. Chong Seung King, the Dean of Faculty of Medicine and Health Sciences, Prof. Dr. John Paul Judson, our chairperson of CRNCD, Dr. Ling Wei Chi, our advisor, Mr. Mohammad Noor Zulfikri, our head of the department, physiotherapy department, for always supporting us, Ms. Maha and all our committee members who put in a lot of effort in organizing this webinar today successfully. And of course, to all our participants who joined us on this beautiful Sunday morning. So that will be all. Thank you very much, everyone. See you soon. Signing out, myself, Aarti from the UTAR Physiotherapy Department. Take care and stay safe.